Panelists.
All participants, please. Can you hear me? Participants?
Yeah.
Yes. Please join with first your name and in bracket as your participant number. You should rename yourselves with your name and in bracket participant number. Hi, all the participants. Good morning. Please join with your name first, and in the bracket P with your participant number. P1, P2, P3, P4, like that. Because it is not fully visible in the chat box sometimes. So we need to know your number and your name fully. Can you do that? Yes, very good, Pawan. Has everyone joined? P1?
Hello. Yeah, ma'am.
P2? Participant 2? Okay. P3?
Yes, ma'am. Present, ma'am.
Okay. P4?
Yeah, I'm here.
Where? Okay. P5?
Yeah, I'm present.
Okay. Your, can you rename as P5? Arosh, right?
Yeah, I just cannot change the name. matlab, I'm not able to.
You can log out and log in if that is the issue.
Okay.
Rename, you get the option there.
Okay.
Okay. P5. Okay, Arosh. Then P6?
Yes, ma'am, present.
Where are you? P6. Yes, Lakshya. P7?
Yes, ma'am. Present, ma'am.
Okay. P8?
Present, ma'am.
P8?
Yeah, present.
I didn't get you're not getting it. No? Where are P8? Yes, Vaibhav. Okay. P9?
Yeah, present, ma'am.
Yes. P10?
Yes, ma'am. Present.
P11?
Present.
Okay. P12?
Present, ma'am.
Okay. So everybody has renamed. P5 one was not able to rename. Did you rename? Is he there? Arosh? Aro, right? Aro or Arosh? Okay. All of you can turn on your videos, please.
A very good morning to one and all, seeking the blessings of His Holiness, Jagat Guru Dr. Shri Shivratishwar Rajendra Mahaswamiji, and offering my humble pranams to His Holiness Jagat Guru Shri Shivratishwar Deshkendra Mahaswamiji. As Aristotle said, the mind is not only knowledge but is also the ability to apply in practice. To test your knowledge and its application, the clinical quiz of Asclepius Occam's razor is back. The journey of Asclepius started in JSS Medical College, JSS Academy of Higher Education and Research, Mysuru, back in 2018. Which proved to be a great success. It was conducted in 2019, in which immense improvements were made, and in 2020. The conference was held completely online due to the COVID-19 pandemic, with no compromise on the equality. Continuing its footsteps this year, we have organized Asclepius 4.0, biggest than ever before. In addition to it, this year we have opened the conference to the International Medical Conference students as well. This year, the conference has been sponsored by Mero, Lecturio, SIMSA, and PICMON. Coming to today's events, Occam's razor is a clinical quiz named after the principle which states that a single experience is most likely in the medicine, and that entity should not be multiplied beyond necessity. This quiz aims to provide the experience of a clinical setup where the participants will narrow down the multitude of patient symptoms into a single diagnosis and discuss management and treatment. The various rounds of the quiz are designed to force abstract thinking and interrelate various principles while making no more assumptions than necessary. So it's time to put your thinking caps and dive into the depth of medicine and take a step further towards becoming better.
A very good morning to one and all. The quizmaster for today's quiz is a very dear and respected assistant professor of our college, Dr. Varsha. Dr. Varsha Tandur is a physician by profession and has been working as an assistant professor in the Department of General Medicine, JSS Medical College, for the past 2 years. Being a clinician and a teacher at this prestigious institute, thyroid disorders and hematological disorders are areas of her special interest. Ma'am has presented her work on hypothyroidism, effect on cardiac function, and lipid abnormalities in the Indian Science Congress 2016. And she plans to continue similar studies with help of her seniors, colleagues, and students. She has 4 publications under her wing and has participated in clinical trials under the guidance of Dr. M. Mahesh, Professor of General Medicine. Ma'am has also now been a co-investigator in the Sputnik, Molnupiravir, and BCG trials for COVID-19. She has conducted an individual painting exhibition at KPCon 2017 with the help of the organizing committee and was a part of the souvenir committee for KPCon 2017. She has conducted painting exhibitions at various places. Ma'am is also very enthusiastic about quizzing. She conducted the state-level Govindappa Memorial Quiz on General Medicine for interns by MPMRT and API Mysore chapter in 2020. We hope you have a good time getting quizzed by ma'am today. Lastly, my name is Aishwarya Bhatt, and this, who introduced all of you to the event, is Kshitish Srivastava. We are third year undergraduate students in JSS Medical College, and we are the organizers for today's event. We warmly welcome all of you and hope you have a great knowledge and knowledge enriching experience today.
Thank you for the introduction, Aishwarya. So I'm Dr. Varsha. Since everybody is visible, I will also show my face. Okay. So hi everyone, and congratulations on entering into the quiz. Let's have a very nice quiz in the way that all of you will participate and hope there is no malpractice. Understood? And there is no prompting. You answer to whatever you know. Okay. It has been. Let's enjoy the quiz. That is the first aim of this quiz. And increase your knowledge with your enjoyment. Okay. All of you are set? Okay. Shall we begin? Shall I begin? All of you are comfortable? In between each rounds, if you have any queries, you can ask the query person for any references or something like that. But if your internet goes off or some issues are there, please message us directly, or you message us directly into the WhatsApp group which has been formed. Okay. Okay. So I will be telling you the rules, regulations, but my decision will be final. Okay. Then okay. Yeah, I would like to have your introduction from which college you are and which year you are. That would be nice rather than just knowing you as participant 1, 2, 3, 4. Participant 1.
Hello, ma'am. Am I audible?
Yes.
Hello. Yeah, ma'am. I'm Shivam Singh from Institute of Medical Sciences, Banaras Hindu University, a final year
Your audio
student.
is not clear. Right?
Hello.
Your audio is not clear. Can you directly speak from the computer? If just see.
Hello. Now is it okay? Hello, hello.
Yeah, it is, but there is a blurring. I mean, clear pronunciation of words, like it's not clearly audible here. Voice is okay. The volume is okay.
Oh, ma'am, that maybe there's
Right?
some connection issues here. A little bit of connection issues happen now and then. Can't control them. Your video is paused, I think.
My internet. Can you speak so that can you introduce yourself so that we can analyze?
Hello, ma'am. Am I audible?
Yes, this is clear. So,
Yes.
yeah, tell me, you are from?
Yes, I am from Midnapur Medical College, West Bengal, third prof part 1.
Okay. Okay, next, participant 3.
Good morning, ma'am. This is Falak Dhaka from AIMS Rishikesh, ma'am. I'm final year student, 17 batch.
Okay. Very good. Participant 4.
Good morning, ma'am. This is Amit Singh. I'm a third year student from Jipmar, Pondicherry.
There is a lag.
Hi, ma'am. This is Amit, ma'am. I'm a third year student from Jipmar, Pondicherry.
Okay, welcome. Participant 5.
Good morning, ma'am. I'm Arush from AIMS Delhi.
Okay, which year?
Third year.
6.
Hi, ma'am. I'm Lakshay from UCMS Delhi. I'm an intern.
Intern. 7.
Good morning, ma'am. Ma'am, I am Soumya Tathagat Behra from IMS BHU, final year student.
8.
Good morning, ma'am. I'm Vaibhav Agarwal from Arjikar Medical College, Kolkata. I'm in internship here right.
Very good. Welcome. 9.
Good morning, ma'am. I'm Venkatesh from Chengalpattu Medical College, Tamil Nadu. I'm doing my final year.
Okay, welcome. 10.
Good morning, ma'am. This is Ashmita Jain. I'm currently a third year medical student from Seth GS Medical College and KEM Hospital, Mumbai.
Welcome. 11.
Morning, ma'am. My name is Pawan. I'm final year UG from Usmania Medical College, Hyderabad.
Welcome. All the best. 12.
Good morning, everyone. I am Shiveha Verma, and I'm a final year student from Maulana Azad Medical College, New Delhi.
Okay, welcome. Good luck, all of you. Shivam, can you speak again?
Yeah, ma'am.
Yes, this is better. And the first was not very good. Okay, can you speak? You are from?
Institute of Medical Sciences, BHU, Varanasi. Final year student.
Varanasi. Okay. Yes. Am I audible with mask? Participant 1?
Yes, ma'am.
Yes. Okay. I shall go on about the rules of the quiz now. Okay. Please share screen one. Only host. Thank you.
Screen share. Steve the PPT. Share.
Okay.
This direction.
Okay, so we will begin the Occam's razor nouns. Okay, so the rules of this quiz will be first, okay, let me tell you the price. The first prize is 6,500 plus 6 months free lecture year subscription, and second prize is 3,500. So the first rule is that the decision of the quiz master is final. Participants should ensure that there is no disturbance and their mic is turned off when they are not answering. They should make sure that their video is turned on at all times throughout the quiz. Please don't turn off your videos. Failure to do so will result in disqualification or negative marking. Participants will be monitored all times, and any form of malpractice will amount to disqualification. Any issues with the network connection on your side will not be entertained. Please ensure that you are seated in an area with strong and continuous internet connection. If participant has any query at any stage of the game, please type it out and send it to the person named query in the Zoom chat box, and don't send to everyone. Okay, there are two there is pounds and there is bounce in few of the rounds. Pounds rules. Okay, pounds is the interval in which the other participant can answer who knows the to whom other than the participant to whom the question is directed. Okay, so in this time, the participant to whom the question is directed should not answer. So the first 30 seconds we are keeping it for pounds in the pounds rounds. Okay, if they do so, the question will be deemed invalid and the next question will be directed to the next team. Okay, you will not get any marks for that question. Your turn will go. The quiz master will ask a question and will say pounds open. In the first 10 seconds, the participant should intimate if they wish to pounce by typing AA in the chat box to the person named pounds privately, not to everyone. After 10 seconds, I will say pounds close. Any intimation received after 10 seconds, it will not be considered. Okay. After intimation, participants will be given 20 seconds in which they have to send in their answers to the same person, pounds privately. We will see whether the answer is correct or no, and we will be allotting the marks. It is not compulsory to pounce in pounds. If the answer received on the pounds is correct, then participant will receive extra points of 30 points. Okay, even if the question is not directed to you, if you pounce and it is correct answer, you will receive 30 points. If the answer received on the pounds is wrong, or the participant who has pounced and does not answer within 20 seconds or does not answer at all, okay, then 10 points will be deducted from your score. So if you are pouncing, make sure you know the answer and you send it within 20 seconds. Okay. Bounce rules. If a participant to whom the question is directed fails to answer or answers incorrectly, then the question will be bounced, or that is passed to the next participant. The participant to whom the question is passed gets 30 seconds to answer the passed question. Okay. If a participant gives the correct answer on the bounce, then they will be awarded 0.5 times the points. That means if it is 20 marks question, you will be awarded 10 marks. There will be no negative marking for the bounce, and quiz master's decision will be final. What? We'll start with the rounds now. So we have divided into quarterfinals, semi-finals, and yes. Anybody has
Excuse
any?
me, ma'am. Sorry to
Yes.
interrupt. Can I just get like 1 minute to change my device, ma'am? I'll rejoin.
Yes, yes. Okay. Anybody has any issues? Please do it right now before I start the quiz. Shivam, can you speak again? Because only his voice is not clear.
Yeah, ma'am.
Yeah, this where you are positioning yourself, that is correct. Okay. While answering, please be in that position and answer.
Okay, ma'am.
Hello, ma'am.
Yes.
Ma'am, can we self-count for our question?
No, it is for the other participant. You can pounce yourself. You can pounce in others' questions, not self-pounce.
Okay, ma'am. Thank you.
Yes. Because that question is anyways going to be asked to you only specifically to give points to you. You have another 11 questions where you can pounce.
Excuse me, ma'am.
Any doubts?
Yes, ma'am. Ma'am, is this pounce and bounce applicable to all the rounds? Like there is an option.
I will be telling you for which round it is. Each individual round rules I will be telling you. Only for few rounds we have 2 rounds we have pounce, 2 rounds we have bounce. Okay. And 2 rounds we have the option of you selecting the question number which you want to select. And the finals.
Ma'am, suppose we pounce and we get the answer wrong, but the participant to which the question is directed, he gets the answer correct. So, ma'am, that question will be invalid for pounce right now. We won't be getting any negatives for that.
No. You are confused. You will be. So whoever is pouncing, it is only chat box, not telling. Okay. After the pounce closes, only then then I will ask the participant to whom the question is directed to answer. Understood? That he will be answering on mic.
Okay, ma'am. Okay, ma'am. Got it.
So whoever is typing pounce, nobody should type it in the chat box to everybody. Okay, make sure you are privately sending the answer to the pounce person. Or you are making that invalid, and the one person who is going to do that question as invalid will be having negative points. -10. I will deduct the points. Clear? Did he rejoin? Yes, ma'am. The person who asked me to wait.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. It is clear.
Yes. Okay. So, any more doubts by anybody before we start? So the time is 9:45. Okay, we took a good amount of time. Shall we? All of you are ready? So we will be starting from participant 1. Okay. When I say your time starts, then you can switch on your mic. Till that time, everybody please be in mute. Okay, all participants. Quarterfinals, we have 2 rounds. So first round 1, we are starting medical emergency. Okay. So please listen to the rules and regulations. Each participant will get 1 question about the case presented in the emergency room, and he has to state how they will investigate and manage, or whatever the question is regarding, like what treatment or whatever the question is there in the given question. Time limit will be for each question 60 seconds. You have to answer within 60 seconds. Anything beyond 60 seconds, we are not taking it. Timer will begin after the question has been read out by me. Okay.
participants will receive 20 points for every correct answer. Okay. Pounds and bounds are not applicable because this is a thought out answer has to be given. Detailed answer, whatever you feel has to be given. How will you manage in that emergency room? And quiz master will decide how good the answer is and score will be awarded likewise. Okay, I will be awarding either 20 or 10. No in between marks. Okay, quiz masters decision will be final and binding. So participant 1, are you ready? Shall I ask you the question? Yes.
Yes.
So a 15-year-old male presented to EMD with sudden onset of excruciating pain in the groin and hypogastric region associated with nausea and vomiting. He also gives history of constipation. On examination, patient is afebrile, scrotum is tender and swollen, and the cord is tender and palpated above the testis. Cremasteric reflex is absent. Scrotal exploration through a transverse scrotal incision was performed. Testis was found to be viable. What is the next line of management of this condition? Your time starts now. You can think and answer.
Okay, ma'am. This looks to be a case of testicular rotation. So the thing is that in this case, since the incision has already been made, so to reverse the torsion, we need to manually derotate the testis, and also we need to fix the testis to the underlying skin by means of suture. Also, we have to operate on the contralateral testis because there is always a risk of recurrence on the opposite testis. So we have to perform the surgery on both the testes.
Okay. Okay. So which sutures do you want to use? Absorbable or non-absorbable? Since you answered.
Non-absorbable, ma'am. Because if we put absorbable sutures, that will get absorbed and again there can be recurrence.
Yes, right answer. Okay. So since you have answered it correctly, fully, 20 points. Next. So participant 2.
Yes, ma'am.
Yes. Okay. You can mute. You can mute. Then, okay. He has some disturbance. Is your mobile nearby? Or are you logging in mobile only?
No, ma'am. In laptop.
Okay, there is some disturbance from your device. Huh? Laptop video is not like this, right?
Hello, ma'am. Is it okay now?
It's a phone. Is it a phone? Because laptop video doesn't come like this.
Ma'am, it is a HP laptop plus tab, that one.
Tab, okay.
Yes.
But is your phone nearby? Can you just keep it away? Because we are getting a disturbance.
Now it's okay.
Better. Okay. So I will go ahead with the second question. You can mute it. Mute. Yeah. Question number 2. A 48-year-old woman presents to the emergency department with a severe headache. The onset is abrupt and persisting for more than 11 hours. She informed the doctor about sudden loss of consciousness for a brief period of time when the attack started. Pain is diffuse, throbbing in nature, no history of recent fever, vomiting, neck pain, or any change in the vision. Her past medical and family histories are unremarkable. On examination, her temperature is 37 degrees Celsius, BP is 132/80 mmHg, heart rate is 80 beats per minute, respiratory rate is 15 breaths per minute. Her pupils are equal and reactive bilaterally. Fundoscopic examination reveals normal findings. Neck movements indicate some rigidity. Her neurological examination is normal. CT scan of her head is also normal. What should be the next investigation to arrive at a meaningful diagnosis? Your time starts now.
Ma'am, we need to do a lumbar puncture to differentiate between SAH and meningitis.
Okay.
Yes.
What is this condition between? What you want to differentiate between?
SAH and meningitis.
Okay, but what likely it is here?
It is likely SAH.
Yes. Okay. So 20 marks to you. So diagnosis is SAH, CT without contrast, or negative CT if it is there, then CT angiography and lumbar puncture. But here we wanted lumbar puncture as the answer before going ahead with CT. Okay. Participant 3?
Yes, ma'am.
Okay. I am audible, right?
Yes, ma'am. Yes, ma'am, you are audible. Yes, ma'am.
60-year delirious male patient is brought to the EMD by the police. The police found the patient sitting on the footpath covered with multiple blankets. Patient claims his family members are after his life. On examination, patient is severely hypotensive with dyspnea and bradycardia. There is marked puffiness of face, nose, and lips. The patient shows decreased mentation and cool, pale skin. Laboratory examination shows hyponatremia and hypoglycemia with elevated serum creatinine phosphokinase. What should be the first line of or management, or what? How do you manage this case? Time starts now.
Hello. Yes,
Yes.
ma'am. Ma'am, with the given history of being delirious and the patient plus the having autonomic dysfunction in the patient and the lab findings showing that there is elevated CPK, I suspect this could be a case of neuroleptic malignant syndrome, provided the psychiatric history is also there. So the patient might be like, firstly, by ensuring the ABCD of the airway breathing circulation, because the patient is in autonomic dysfunctions. So we need to secure the airway breathing circulation, and after taking care of all the ABCDs, then we can proceed with the specific management led by giving dantrolene and plus. Okay.
Yeah, but the approach is not right, Falak. The answer is wrong. No marks to you. There is no negative marking. I will display the answer. Okay. It is a case of myxedema crisis with features of psychosis. Okay. So here everything, whatever the scenario was given, was because of severe hypothyroidism. Okay. Airway, then management, everything is fine, but the treatment is correction of hypothyroidism in this person with IV levothyroxine. Okay, so that is the treatment in this patient. Okay, okay. Participant 4.
Yes, ma'am.
Okay. So, and I'm displaying next question for you. This is a 35-year-old male presents with chest pain, hemoptysis, and dyspnea. Chest X-ray showed following findings. ECG findings are as below. Which is the principal imaging test which is to be performed to confirm the diagnosis of this case? Time starts now.
30 seconds left.
The diagnosis from CT chest, I'm not sure.
Imaging test. Why? What is the gold standard?
CT chest, ma'am.
No, that is not the answer.
Time up.
Time up. Okay. So,
And then the problems. Ishan named person who's texting on the group to everyone.
what is the testing? Texting?
Texting. He's giving the answers.
He's, I think he can't reply. Am I disable the chat?
Yes. Why is he doing that? Is he a participant?
No, ma'am.
Then from where he has joined?
Attendees can't text anymore.
Huh.
I've disabled it.
You had not done it. But that answer is wrong. That is fine. But
Ma'am, please exit it.
yes. Sorry for the trouble. But the answer here is Amit. This is a case of. What do you think it is a case of? Let the investigation be. Can you guess?
Not sure, ma'am. Boer
Not
have.
sure. No. So the ECG is showing you the S1Q3 T3 pattern. Okay, S1Q3 T3 pattern, and there is a wedging non-oligamic picture in the X-ray suggestive of pulmonary embolism. So CT chest with pulmonary angiogram, okay, with intravenous contrast is the imaging test for this condition. Okay, no marks, but you should know. Okay, next question number 5 for participant 5. Participant 5.
Yes, ma'am.
Okay. You can mute. 22-year-old unconscious female was brought to the emergency department by her family. On examination, patient was in respiratory distress. Temperature was 38 degrees Celsius. BP was 100/70 mmHg. Okay. So on asking about the history of the incident, patient's father informed the doctors that the girl had ingested 8 to 10 pills of her mother's prescription. Her mother was diagnosed of insomnia 4 months back, for which she was prescribed sedative medications. Which antidote should be used to treat the diagnosed poisoning based on this history? Time starts now.
Then benzodiazepine poisoning.
Okay, but what is the antidote? Question is.
Arey yaar.
$30 seconds left.
Ma'am, it's something from F.
Yeah. We can't see your video also, Arush. Yes.
Flumazenil.
Time up. But can you show me your room?
I'm sitting in the balcony, ma'am.
Can you show your balcony only? Because you are turning here and there while answering.
The camera is not fixed, ma'am. Matlab, I have held it in my hand.
Huh?
It's not fixed.
Yeah, please. I will not award you because you were out of time. But can you show me your surroundings, please? Where are you, man? Arosh.
Yes, ma'am.
Yes, I will not give you the marks. Sorry, you were out of time. Okay, time up.
Ma'am, isn't the answer from Azanil?
Answer is correct, but you were
Ma'am,
out
I
of
answered
time.
it before time. I answered it before time.
Huh? You answered it before time?
Yes, ma'am.
Okay. Okay, 20 marks to you, but I should not see you turning around and around while answering. You keep it stationary.
Okay, ma'am.
Okay, 20 marks to you. We got a doubt that you are doing a malpractice. That's why.
I don't have any other device, ma'am.
Specific antidote is flumazenil, and the most common drug for insomnia prescribed is benzodiazepine. So you give stomach wash and all that, and with that IV fluids, hypotension is corrected, and here there was no, not much, 100/70, but still you have to give IV fluids. Specific antidote is flumazenil. Participant 6.
Yes, ma'am.
So, 45-year-old patient with history of hypertension is currently hospitalized for the complaints of acute loin pain, oliguria and hematuria. On MRI, the below thing was seen. Okay, MRI findings. While he was admitted, he had a sudden loss of consciousness preceded by a severe headache. Okay. On examination, there is loss of ipsilateral light reflex and subhyaloid hemorrhage on fundoscopy. Okay. GCS score was 13 with no motor deficit. On lumbar puncture, CSF contains bilirubin. ECG findings are given below. What is the most common location of the pathology and its management we are asking? You cannot just tell the location. Okay, time starts now.
It seems to be a case of polycystic kidney disease leading to berry aneurysm rupture, causing subarachnoid hemorrhage, and the management will be the 3H principles: the hemodilution, hypotension, and 1H more.
Location?
Junction of PC and PCOM.
What is the management you want to do? Specific.
Ma'am, we can also do clipping, endovascular clippings.
Okay. Location?
Ma'am, berry aneurysm and circle of Willis.
No, everything comes into circle of Willis. You can't tell like that. Location.
Junction of PCA and PCOM.
Okay, time is up. Time up. Okay, so I will award 10 points to you for getting the management right, but not the location right. Okay. So the location is basilar artery. Okay. But whatever you told, clipping, I will take it. Coiling, okay. Coiling and clipping, both are okay. Okay, so but along with that, you have the management of seizures, okay, and in airway management, that is all general which you do. Then the 3H principle, okay. Okay, participant 7, 10 marks to him, Lakshya.
Yes, ma'am.
Next question. 24-year-old male presented to EMD with excruciating pain and swelling in the left lower limb following a road traffic accident. On examination, patient appeared toxic and hemorrhagic bullae with serosanguinous discharge were found on the affected area. What is the preferred medical line of management of this condition? Time starts now.
I think it is gas gangrene, and the preferred medical line of management will be antibiotics against it, after which we can do debridement. wound
Which
debridement.
antibiotics? Which antibiotics? That is the answer. Which antibiotics?
Ma'am, penicillin can be given in case of this infection.
Okay,
And it also responds to beta-lactams, penicillin.
that iron?
Ma'am, I cannot understand what are you telling.
And what else? Only penicillins are not advised. Another drug.
Metronidazole,
Okay, that can be used. Another drug?
clindamycin.
Yes, very good. Okay. Time up. So we wanted clindamycin. Nowadays, it is the most preferred line of management. Penicillin and clindamycin. Okay, very good. 20 marks. Okay. I will go to participant 8. Yes. After that, debridement. You're correct. Next. 8.
Yes, ma'am. Am I audible?
Yes, Vaibhav. Okay. So it is a 65-year-old man who came to the emergency department with complaints of severe chest pain. Pain is sudden in onset, tearing in nature, is always present at the same location. It radiates to back between scapula. Patient is a chronic hypertensive and also has a previous history of MI 8 years back. Current systolic BP was more than 150 mmHg. On auscultation, he had an aortic insufficiency murmur. Well-lead ECG was done, but nothing significant was found. Chest X-ray shows widened mediastinum with abnormal aortic counter. CT scan was done immediately afterwards and diagnosis was made. What is the immediate next management since the condition is life-threatening? Your time starts now.
Hello, ma'am. Am I audible?
Yes.
Yes, ma'am. Probably depending upon the case, given history and hypertension and everything, probably the case is of aortic dissection. So the immediate first line of management, I'll try to reduce the blood pressure by giving IV beta blocker like esmolol, and followed by that CT scan will show, depending upon Stanford and Bebeke classification, I will proceed to surgical management if required.
That is true, but what other IV drug would you want to use?
IV drugs like esmolol can be given.
And
Calcium channel blockers can also be given.
One more?
And nitroprusside or nitroglycerine can be given.
Okay, very good. I will give you full marks for this. Okay, 20 marks. So you have got it correct. The diagnosis is correct. And beta blockers and acute reduction IV. You can give beta blockers, sodium nitroprusside. When it is contraindicated, you can use calcium channel blockers. Everything what you said is correct. Correct. Then next participant 9.
Yes, ma'am.
So 50-year-old man with a history of stable angina and a positive exercise stress test presents for cardiac catheterization. During the procedure, he developed tachycardia and became hypotensive. The anesthesiologist noticed that his systolic pressure fell even further on inspiration. His ECG showed QRS variation with each impulse. Which treatment will most likely lead to a resolution of this patient's tachycardia and hypotension? Your time starts now. What is the condition you think?
This is the case of ventricular fibrillation or ventricular tachycardia.
No. ECG is showing QRS variation with each impulse.
Cardiac tamponade.
Treatment.
Time up.
Okay, time up for you. Your name is Venkatesha.
Yes, ma'am.
Yes, I will not award marks to you, but because you didn't tell me the treatment. The question, you got the scenario right at the end, but the treatment was the question. Okay.
Okay.
Emergency pericardiocentesis. What was he undergoing in your history? He was undergoing a cardiac catheterization. Okay. So there was an cardiac tamponade and emergency pericardiocentesis was needed in this patient, and management of heart failure and anti-ischemic regimens. That was the answer. Okay, Venkatesh. Next, participant 10.
Yes, ma'am.
45-year-old male presented to the EMD with sudden onset of severe pain abdomen since the last 4 hours in the umbilical region, associated with multiple episodes of vomiting and passage of stools with altered blood. He is a known case of atrial fibrillation. On examination, abdomen was not found to be rigid. CBC revealed neutrophilia, while CT abdomen did not reveal any gas in the lumen of the bowel. What is the management of choice in this condition to deliver a favorable prognosis? Time starts now. It is outside the lumen of the bowel. CT does not show any gas outside the lumen of the bowel. Okay.
Ma'am, is this SBP? Spontaneous bacterial peritonitis? And the management will be to start antibiotics and manage the stable vitals of the patient.
You have time, think. Atrial fibrillation is a known case of atrial fibrillation.
This could be atrial fibrillation. So thrombosis. Intestinal ischemia causing ileus, paralytic ileus because of the ischemia.
But I'm asking management.
Time up.
Time up. Okay. In the end, after prompting, you got the answer correct, but the management was, it was ischemia, mesenteric ischemia. He's a patient of atrial fibrillation. So we wanted to do a laparotomy with embolectomy. Okay. So there was a embolus which was obstructing, and you have to do the embolectomy via ileocholic artery. Even if you had told me embolectomy, I would have given you the marks. Okay. No marks for you. Okay. Next. 11.
Yes.
68-year-old right-handed man presented to the emergency department for evaluation of a possible transient ischemic attack. He complained of right arm weakness and unsteady walking. The patient also stated that he had difficulty speaking for 10 minutes on the previous day. Okay. CT angiogram revealed 40% and 80% stenosis of left internal carotid artery and left middle cerebral artery, respectively. He was not on any medications. In addition to assessing the relevant risk factors, which intervention would be most appropriate at this point of time? Your time starts now.
My intervention would be to relieve the stenosis of carotid arteries by stenting.
Okay, but appropriate, what you can go through the question again.
And also put the patient on anticoagulants.
Okay. Which one? First, what do you give?
Aspirin.
Yes. Okay. I'll give you marks. Okay. So this is 20 marks for you, but we will not directly start with because he doesn't have maximum. See here, He had a TIA, complaint of right arm weakness, unsteady walking, CT angiogram. They have not told us the MRI report or anything, but he is not in any medications right now. So we will first optimize the medications, and then you go ahead for the any treatment of like endarterectomy or something. But here it is only 40% left internal artery. So not much, we will go ahead with this. Okay, we'll just give aspirin. Okay. Question number 12 for participant 12.
Yes, ma'am.
Okay. Okay, next question. A 45-year-old female presented to the emergency department with diffuse multiple skin eruptions covering the limbs, abdomen, thorax, and the back. On examination, these lesions were found to be erythematous with follicular accentuation. Lymphadenopathy and hepatosplenomegaly were also noted. Okay. On CBC, lymphocytosis and peripheral eosinophilia was noted. On LFT, alkaline aminotransferase is twice the normal, and alkaline phosphatase is 1.5 times the normal. Serology, there is absence of viral hepatitis markers. Okay. So on history, she revealed that she has been suffering from severe pain, redness, and swelling of knee, ankle, and great toe since the past 1 year, for which she has been taking some medications. Okay. 2 days ago, she was prescribed a new medication. How will you manage this case? Your time starts now.
Ma'am, it's possible that she suffered a drug reaction to the new drug that was introduced. So first of all, we will stop that drug, the new drug that was started. And for the reaction, we can give antihistaminics and such to relieve the allergic reaction.
What else?
Ma'am, anti-allergics, antihistaminics have been done. And ma'am, then, ma'am, since, ma'am, hydrocortisone could be given. Yes, ma'am.
What is this condition you might think? Drug reaction with whatever is on CBC?
Ma'am, this could be, ma'am, Steven Johnson to nahi hoga.
A part of it, but a little something. Okay, I will give you marks. No issues in the marks, but it can be a part of that. It is a DRESS syndrome, drug rash.
Okay, ma'am. Yes, ma'am. Yes, ma'am.
Okay, with eosinophilia and systemic symptoms. DRESS syndrome. Okay, what else can be used? Just for your antihistamines and hydrocortisone is okay. What else can we use?
Ma'am, if ma'am, I know these two only.
Okay, 20 marks, no issues. But for T and IVIG also can be used. Okay.
Okay, ma'am.
Question number 13. Oh, sorry. I was having in 12. You are the last person, right? Okay, so should we tell this course? Or we'll do after the connect the images. Okay. We will announce with connect the images, finally. Okay. Next round, we are going ahead with connect the images. Okay. Whoever has not scored now, please gear up because you have a chance to increase your marks. We have kept the rules. We have kept polls open in this. So even if you have not scored marks in the medical emergency, you can score extra marks here and get into semifinals. Okay. So shall I tell you the rules of this? DRESS syndrome. This is fine. So it's an image-based round wherein one question will be directed to each participant. Okay. So if 3 to 5 images will be displayed on the screen together. We are not doing one. Together it will be displayed. and time limit for each question will be 60 seconds. Please note, this round is very strict about timing. Earlier was explanation, so I was lenient on that. The timer will begin as soon as the question is displayed on the screen. I am not talking anything here. Okay, it will be displayed on the screen. Only if there is some question related to it, I will ask the question and correct answer will get 20 points, but there is no negative marking until and unless you don't create any issues. Okay, so no negative marking. Only pounds is applicable, no bounds. Okay. So are the rules okay? Ashwin,
I have a doubt.
Yes.
One doubt.
Ma'am, so there's no negative marking after pouncing also if we pounce incorrectly?
No, for that it is there. For negative marking for pounds is there. But for the person who is telling, if he tells wrong, we are not giving participant negative marking. If they, to whom the question is directed. Okay? Did you get it?
60 seconds. Initially in the pounce rules, it was said that we have to pounce within 10 seconds and then answer within 20 seconds.
See, the general pounce rules apply to this. It means if you are pouncing, you have to pounce within 10 seconds, answer within 20 seconds. That means total of 30 seconds. The participant to whom the question is directed to can only answer it after 30 seconds. And they have a time of 30 seconds to answer it. Okay, understood? Only 30 seconds. So question will be displayed for a total of 60 seconds. First 30 seconds, you are not supposed to answer the question. Because if you answer, others are getting extra marks because we have kept pounds open. So if you want others to get extra marks, then it is your loss. Understood? When I tell pounds close, then you switch on your audio and answer the condition.
Ma'am, pounds, when you say pounds close, we'll have to, the other participants will also type an answer, right?
Where they will answer? They will answer to the pounds person, not in the general.
Ma'am, one doubt, ma'am. Ma'am, the pause interval will begin from the moment the question is displayed.
What?
Ma'am, the pause interval will begin as soon as the question is displayed on the screen.
Yes. 60 pounds interval, 60 seconds, total of 60 seconds, the question will be displayed. In that first 10 seconds is for pounds. Okay. Next 20 seconds is for answering. Within 20 seconds, whoever answers will be taken. If you are pounced and if you do not answer, it is negative marking. Only for all this is for only pounds person, not for the participant to whom the question is displayed. Understood?
Okay, ma'am.
Now, if the person to whom question is directed, if he answers correctly, then will we get the pounds marks or we won't get?
No, it is 20 marks for you people. Whoever pounces will get 30 marks.
Irrespective of the answer which is given by the question, to the person to whom the question is directed to.
No, you are getting confused, I think. See, if I am asking you the question, Soumya, so you will be having only 30 seconds to answer after the pounds closes.
Okay, ma'am. Okay.
Understood. If you answer within first 30 seconds, others who have pounds will get your answer and type it, and they will be getting the marks. So please do not answer. Only answer when I tell pounds closes to the participant to whom the question is directed. Is it clear? If you want, I will explain again.
Ma'am, I have a question.
Yeah.
Ma'am, I have a question that first 10 seconds for the other person will pounce, and then in the next 20 seconds he has to answer. So how does the person know that 10 seconds is over?
I will tell pounds open, pounds close.
And after the pounds closes, then the person answers. The other person who are pouncing. Like they have to answer after the 10 seconds.
Pound seconds. See, pounds open means 10 seconds over, I will tell. Then after that, within 20 seconds, you answer. Then I'll tell pounds closes. Then I will ask the participant to answer.
Okay, ma'am. Okay.
Understood?
Now one more doubt. The person who pounces the question, like he has to answer in the in the chat, like in the chat box to the privately to the pounds person, or like do we have to say the answer aloud? Like just
No. If you say the answer over, it is all
Yes, ma'am.
invalid. It is only typing. Please.
Okay, ma'am. Yes, ma'am.
No opening. The only person to whom I am asking has to turn on the mic only when I tell pounds close. I mean,
Yes, ma'am. Got it.
Ends. Yes. Any doubts? Any clarifications? I will say pounds open, 10 seconds over. Then 20 seconds. Within 20 seconds, you answer. Pounds closes. Then the next person to the participant whom I am asking questions should answer within 30 seconds. That person has to switch on the mic.
Ma'am, I have a doubt. Ma'am, suppose the question is to participant 1. I pounce and I get the answer correct. And participant 1, after the 30 seconds are over, means the pounds window is closed. After that, he answers correctly. So will we get marks for that pounds, or that question will be invalid for pounds?
No, it will be right. What participant is doing is irrespective of what you type in the pounds box. Okay? No doubts?
Okay,
Yeah,
ma'am.
ma'am.
Got it, ma'am.
Ma'am, how many marks will be awarded for getting the answer correctly in pounds question?
You will be answering, no? And the other person who is telling the answer will also be telling. Or else I will be there to tell the correct answer. Huh? Points you are asking or answer?
Yes, ma'am. Points.
Points, if you get the answer correct in the pounds rounds, it is plus 30. For
So-
all participants who people who pounds, we are giving awarding 30. But who pounds after the 10 seconds will not be awarded.
So other participant will get more marks than our question, ma'am.
Yes, that is the rule. That is what you have. Total, you are 12 participants. So you have 11 chances to pounce and increase your score. Understood?
Okay.
You have 11 extra questions for you where you can score. Other than the question, 20 marks, which is only directed to you. All clear? Any doubts, please get it clear. Because once I display, I will not keep on explaining. First display, it starts, timer starts, 10 seconds, type AA into the chat box to pounds. After 10 seconds, I'll tell 10 seconds over. Type the answer, 20 seconds over, I will tell pounds close. The participant can answer now. Okay, the participant to the question whom it is directed answers. That is time limit is 30 seconds. Marks, if you pounce correctly, 30. If you pounce wrongly, whatever you have scored, it's minus 10. And you pounce and don't answer, minus 10. So pounce only if you are confident. Understood? 1, participant 1. Understood?
Yes, ma'am.
Because you are going first. Okay. So, shall I display the question? Are you ready?
Yes, ma'am.
Okay. You please mute your audio. Okay, don't tell anything. And now I will be displaying the question. Okay. 60 seconds from now. Pawns open.
Ten seconds over. Pounds closed. Sorry, 10 seconds more. Pounds closed.
Pounds closed. So if anybody has pounced within this time, you should have answered. So this is, now you can answer. Time starts now.
Yes, ma'am, I can see the Zell-Wallin pattern. This looks like a case of pheochromocytoma.
Pheochromocytoma?
Yes, ma'am.
But what else? We have given so many things here.
Yeah, ma'am, I just saw that Zell-Wallin pattern and I just that looks like some kinds of retinopathy.
No, I will not give marks to you, Shivam. We have 5 images there. Zell-Wallin pattern is correct, but the other things what we have written, pheochromocytoma, is also correct. But this condition you have not answered, right?
Ma'am, but we had to just connect and answer the question. We didn't need to explain the clues, right?
Yes. What is your answer?
I had answered pheochromocytoma.
No, that is not right. That is what. Okay. So this is when. So we had 2 and 4 participants had pounced. Okay. Second participant was wrong, answered wrong, and 4th participant answered it right. Okay.
Ma'am, I also pounced. Ma'am, I also pounced.
That's what, 10 seconds. Within 10 seconds, within 10 seconds, AA you have to type. Within 10 seconds.
Ma'am, I wrote AA within 10 seconds. Only after I wrote AA, you said pounds open.
Huh? Who did you? To whom did you send?
I sent it.
Because it is written to pounds person, I am telling.
Ma'am, yes, I have sent it to pounds.
We have not received.
Person named pounds. Ma'am, I can send a screenshot if you want. I wrote the AA and also I wrote the BHL.
You send a normal message to the same account which we sent right now, same participant.
You send a message, no? AA?
To the pounds person, no?
Yes.
I have sent.
It's his
We haven't received Lakshay.
Ma'am, I can send a screenshot. I have just written AA and the previous 2 messages will be displayed above those, AA and VHL.
If it is not working.
Plus you've not announced answers, we can check the answer.
Yes, that's right. Okay, you have not answered it, right? You can send me the screenshot to the WhatsApp separately, separate WhatsApp.
Okay, ma'am.
To the organizer.
Ma'am,
timing.
Okay.
For you only we can do on WhatsApp if needed, because within 10 seconds, because your messages are not being displayed.
Ma'am, the one that I wrote now, was it displayed?
No. It didn't come, Lakshay.
Okay, ma'am. Ma'am, so will I get the marks for the first one because I can send the previous screenshot of the.
You can send us within that screenshot. You send me.
I sent.
Confirm that you send to the person whom I tell now. When to whom? You have sent within the time. Yes, it is coming in the other thing, right? Where it is coming?
He sent the screenshot.
Screenshot it is. Yes, Lakshay, your answer is right, but now what we will do from now, one trial now, please. I will not, I have not announced the answer, but I want everybody to type A to the pounds person for now. Each participant, please, since we got this problem, for you, you can type separately in WhatsApp A to the pounds person.
Excuse me, ma'am.
Yes, Amit.
Will that marking for the previous question hold? Like I got marks on the previous question.
I have not told the answer yet, so it will hold.
Okay. Ma'am.
B1 ma'am asked B1 to send it over. B1 hasn't sent it.
P1, P1, everybody, please send now. Please send A to pounds person now.
P1 is also possible.
Participant 3. Participant 3.
3.
Yeah, participant 3.
Participant only.
Six is not.
It's not our issue.
It's not our issue.
It's not our issue.
Where are you, Lakshya?
Yes, ma'am.
Only yours is a problem, Lakshya. Why? Everybody else.
I don't know. I wrote it to the bound person.
Are you
I'll
with
try.
the mobile? Are you with the mobile?
Yes, ma'am.
Why is it so?
Ma'am, actually, I'm in the hostel, and I came to know about the quiz yesterday only, so I don't have any another day.
Tell him to change to mobile.
Any other connection?
Can you change your connection?
Ma'am, it is not possible
change
as
the
of now. Ma'am, it is not possible as of now.
We can't do
I
that.
cannot.
There will be a time lag. ma'am,
Time
because-
lag, no?
Yes.
Yeah, you have to count. We will have a time lag, Lakshay.
Ma'am, for what? Time lag, I don't.
If you are connecting it from the mobile data, there will be time lag.
Yeah, he can.
Ma'am, so I can send it to the WhatsApp. The person I just wrote.
But the time limit is difficult, no, to maintain.
I don't have any other solution.
Yes, we can do one thing.
Ma'am, we received now.
No,
Tell him to send it.
Can you send again? Lakshya.
Yes, ma'am.
A.
Yes.
We are receiving it now. Did you change your connection, internet connection?
Ma'am, I sent it differently first. In the previous one, I sent it using the more option, and now I clicked on participants, and then I was getting the whole list of participants and wrote it like
What?
Ma'am, there are two options. There are two options to send a chat. First of all, in the first one, we can click on more, and then there's a chat option, and then we can direct it to anyone. And the second option, we can get a complete list of participants, and in that participant, we can type on, we can click on the person found and then chat. Because in the second option, I tried and it was going.
Working? Are you correct? It's fine now. Can you send again? Just stop. All of you send AA again for confirmation. I don't want to repeat the questions again.
Yes,
AA. 1, 2, 3, 4, 5.
4. 1, 2, 3, 4.
4, I didn't get A.
Oh, yes, ma'am.
Ma'am,
Now we got-
I sent, ma'am.
There is a lag, Amit.
He sent audio also.
No,
Okay.
ma'am, I sent twice, ma'am.
Yes, okay. 4, 5, 6. 5 Barlila.
6 is come, ma'am. 5 is come.
5. AA.
I sent ma'am.
Ma'am, he's having a network that we can't do anything about it.
Arosha.
Yes.
Arosh, can you raise your hands? Or you can send WhatsApp. WhatsApp.
Again, there will be a lag, ma'am. Again.
See, if you have your internet issues, we can't help now. We have, we can't do more than this. No, can't help. It's not, it won't work.
Ma'am, raising the hand.
Yesterday, we had the same problem. Their network issue is not us. Whoever we
Yes,
get
yes.
first, we'll go ahead with it.
5,
Ma'am, raising the hand.
6,
6,
7, 8,
7,
7 hasn't come yet.
7. There is an issue with this.
I have, ma'am, I have raised my hand and also I have sent A to the pounds person.
Oh,
7 came.
Some 7 just came.
There is a time lag, no?
But it is
Ma'am,
Now I have sent, ma'am. Now I have sent. I had sent earlier when you told all to send at one time, and now I have sent.
Can you send
Just
again? Can you send again?
yes, ma'am. Just a minute, ma'am. I have sent again, ma'am.
Yes. 9, 8.
8 done, 9.
9. Came? 9 came? Nine.
Ma'am, I have sent, ma'am.
Not coming. There's a problem with so many people, man. 9 has not come.
10 is sending once again.
9.
Ma'am, I have sent, ma'am. Ma'am, I have also paused before 10 seconds, ma'am. No answer.
I guess he sent it earlier talking about that.
So they will send it now. ma'am.
Now.
I don't think
I have
so.
sent, ma'am.
Not coming.
Ma'am, we can do away with the bounce rule. We can just go ahead with the quiz.
So many people have visited the site. It will be difficult.
Ma'am, I think 10 seconds is a problem, ma'am.
So many have a problem, then I will cancel the pounds only.
Ma'am, we can have 20 seconds for pounds window probably.
Yes,
That is
ma'am.
so-
Seeing the 5 images, connecting it and going to the chat option and sending it to the specific person for all that 10 seconds.
Why you're getting the extra mark?
Extra marks we are allotting.
Ma'am,
you
can we
other than
just
the
carry
pounds.
ahead with the round, ma'am, with like 15 or 20 seconds, ma'am?
Ma'am, can we send our pounds message in WhatsApp group, ma'am?
Ma'am, can we like raise our hands only? Like, we can-
10. 10. 10.
I'm sent.
Okay. 11.
Ma'am, did you receive my pounds?
No.
Why cannot I see?
Ma'am, I
11.
sent twice.
I sent, ma'am.
Got it.
Got it.
10.
Yes.
10 got it.
10 got it. 11.
Got it.
Got it.
12.
Yes.
Got it.
But
It's
it's
there.
not our problem, ma'am. It's their problem.
So everybody is, we are getting except for 4. Huh?
No, except for
5.
9.
9.
9 we didn't get.
6 earlier we were not
6
getting, but now
we're
we are
getting
getting.
now. And
Everybody's we are getting except for 5 and 9.
Ma'am, I just sent. Did you get it?
Yeah, 5 I got
I
it.
got 9.
Nine got it.
Got it. There are some internet issues from your side only then. Okay. Now we will, for now, if we don't get it, I will not take them into consideration, no more considerations. Okay, we have checked everybody's we are getting now. Right, from 1 to 12. Both it is not possible.
Okay.
Yes. See, I am only taking whatever is there in this chat. WhatsApp, this, I can't, both cannot be handled together. Because you can, not type, WhatsApp again type is not possible in 10 seconds and 20 seconds, I understand. Okay. Within 30 seconds, within 10 seconds, you pounce, and within 20 seconds, you answer. That is there. If you want to change it to 15 seconds also, it's fine. No, our curators are not ready. That is their rules. Okay, 10 seconds you have to pounce. Pounce is only typing A. And you have answering is, you have extra 20 seconds time. So.
Excuse me, ma'am. Ma'am, can we just do away with this AA and directly send the answer within 20 or 30 seconds if we know and not if we don't?
Yes, ma'am. I think this is a better option, ma'am. Within 30 seconds, if we know the answer, we can send it directly.
Not 30 seconds. Within 10 seconds, if you type within 10 seconds. Huh?
Since most of us are using mobile, ma'am, so we can't.
No. So, no changes, no changes. Please. There are no changes. In 10 seconds, you have to type A. Within 20 seconds, you have to type the answer. That's it. There are no more changes. Okay, if you know the answer also, you just pounce A. Okay, because for others we have to see the marks. Yes, done. So we are giving that another person. Only one person, 4 we are allotting marks because of your internet issues, because we are getting everything from everybody. Okay, so only 4 I am allotting plus 30, 2 I am minus 10. Okay, next question I am going to
will I also be considered?
No. Even further also, if anybody has their internet issues and we are not getting questions, I am not taking that because we have checked it.
This was not cleared before. From now on, we can do like this.
Rules were all clear. Because of your internet issues, we have already put a disclaimer that if it is your internet issue, it is your problem. Okay, we are not giving you marks, Lakshya. You have another 10 chances. Okay, next. I will be going to the next question. What is the answer for this? Everybody mute. My slides are visible. So answer is von Hippel-Lindau disease. It was the image of retinal hemangioblastoma, renal tumor, Zell-Ballen pattern in pheochromocytoma, and autosomal dominant pattern of inheritance. That was von Hippel-Lindau syndrome. Von Hippel-Lindau syndrome. Okay. The participant 2.
Yes, ma'am.
Okay, I'm not going to this explanation since we had a good amount of time. So participant 2, mute. Now I will display the images. Start, pounce.
Ten seconds over.
Answer.
Pounds closed.
Okay, pounds closed. You can answer, Aniket.
GBS.
Your answer is GBS?
Yes.
Okay. We have pounced people, correct? We have 8, 3, and 12 who have pounced within time and they have pounced it correctly. So, but the answer is not GBS. Okay. So plus 30, no marks for you, Aniket, but plus 30 for 8, 3, and 12. It is ALS, amyotrophic lateral sclerosis, and the person is Lou Gehrig. Okay, it is also known as Lou Gehrig disease. Okay, images were non-invasive ventilation when they in the last stages, when they cannot breathe, respiratory failure, sclerosis of motor neuron. Okay, and ALS walk logo, that is the ALS walk logo. And since they will develop in the future, in the later stages of disease, they will have a nasal regurgitation and all. So they will have to undergo percutaneous gastrostomy. Okay, so next. So participant 3.
Yes, ma'am.
Okay. So Falak.
Yes,
mute.
Okay.
On starts.
Ten seconds over.
Answer.
Pounds closed.
Pounds closed. Pounds closed. Okay, Falak. If you know the answer, tell me the answer. No, your voice is not audible. Unmute.
Hello. Hello. Okay.
Huh.
Yes. Ma'am, is it ma'am mucopolysaccharidosis, ma'am? Hello.
Tell me.
Ma'am, mucopolysaccharidosis, ma'am, lysosomal storage disorders.
You will tell the syndrome.
Ma'am, Hurler syndrome.
Time is up.
No, time up. Falak. It's not Hurler syndrome. It is a image of Alagille syndrome. Okay, triangular face, neonatal cholestasis, butterfly spine, posterior embryotoxon. Okay, this is the case of Alagille syndrome. Okay, so participant 4, before I go, so many have pounced. 12 has pounced it rightly, 7 wrongly, 1 correctly, 8 wrongly. Oh, we are not done. So that much. Those who did not come in time, into time.
Ma'am, sorry, can you please repeat who all pounced correctly, ma'am?
Amit, your participant number?
4, ma'am.
Four, 1, 12. 4, 1, 12. I have answered it correctly.
Thank you, ma'am.
Yes. All of you should type AA first and then the answer. When I tell, not directly the answers. Okay. Hope I am clear. 4, 1, 12 are plus 30. 7 and 8 are minus 10. No more changes. Next, participant. Yeah, please. Let's go ahead. Now it is participant. 3 questions we finished. Question number participant 4. The question will go to you. Yes, any questions? Any queries from our side? All right. Okay. You have to answer this. Connect the images and answer and type AA within 10 seconds. Other participants. And then the answer. Yes. Don't answer, Amit. Mute. Phones opens.
10 seconds over.
Answer.
Pounds closed.
Pounds closed. Amit, you can answer if you have got the answer.
No, ma'am, I don't know the answer.
Okay. Anybody who has pounced has answered it correctly? Number 12 has pounced correctly. 2 wrongly. 6 correctly. 3rd correctly.
Correctly, but did not say.
Giving time. See that the time limit is very strict. I'm not considering who have answered after 30 seconds. So it is only 12, 6 and 3 who have answered it correctly. 2 I am not giving marks. Minus 10. Okay. If you know the answer, only then you go ahead. Think and giving the answer is not okay. Within 10 seconds, type AA first. Then you answer within 20 seconds. Not after 30 seconds. If you answer after 30 seconds, I'm disconnecting. I'm deducting the marks. Okay. because we are doing extra work to give you extra marks. So answer is Amit. No, can you guess? Just for a guess. No, it is your question.
Ma'am, first image is of Alexander the Great, ma'am. With
That
some
is known.
demyelination.
Yes.
Demyelination.
It is
Alexander.
It is
Alexander's
Alexander's disease only, but it's a leukodystrophy, Amit. Okay? It is an Alexander's disease, leukodystrophy. Why is it a lag? No?
Alexander's disease.
Yes, it's a leukodystrophy. The images were Rosenthal fibers, myelin destruction, and autosomal dominant pattern. Okay? Okay. If you had answered me Alexander's disease also, I would have given you marks.
Ma'am, I have answered Alexander's disease. 2, participant 2.
After 30 seconds. No, nothing after 30 seconds. I'm taking pain to count 10 seconds and 20 seconds. Understood? Yes. Participant 5.
Yes, ma'am.
Yes. Shall we go ahead, Arush?
Yes, ma'am.
Mute. Yes. Count starts.
Ten seconds over.
10 over. No pounds. No, we don't get any pounces for this. Arush, 30 seconds starts from now.
I'm Refsum. Refsum disease. I'm Refsum disease.
Your answer is Refsum's disease? Your answer is Refsum's disease?
Yes, ma'am.
No, it is not right. Nobody got it right. Okay, nobody got it right. Okay. Any guess? You want to take Arush? One more guess? Since we are not giving you negative marks, so I am asking.
Don't know.
Guess. Okay, fine. It was a mercury poisoning case, Schistominimata disease. Where the image was ataxia, and the company which was involved for this, and there is a loss of peripheral vision in this. So that was the perimetry and cerebral palsy, which it leads to. Okay. So what happened? Please type AA within 10 seconds. Participant 6.
Yes, ma'am.
You can mute your voice. Now I will display the image. Please type AA within 10 seconds if you want to pounce. Okay, other participants. So time starts now.
Ten seconds over. Pounds closed.
Pounds closed. Answers after this will not be entertained. Lakshya, your time.
Ma'am, Griden-Ego syndrome.
Yeah?
Griden-Ego. Internuclear ophthalmoplegia, MS.
Time is up, Lakshya. No, your answer is not right. No negative marking for you. But the answer is not right. Any other guess you want to take?
No, ma'am.
Okay. So the images which it is showing is, one is, what is the image of the girl?
Later rectus palsy.
And what is this sign? What is this sign? I sign, it is written there. It means?
Thyroid ophthalmopathy.
No, not thyroid.
I don't know.
Okay. So what are these?
Cavernous.
It is related to that. Okay, it is a Tolosa. What happened? It's a Tolosa-Hunt syndrome, Alakshya. Okay?
Okay.
Those who have pounced correctly? Nobody has pounced. 8 has pounced wrongly. So 8 has pounced wrongly. So minus 10 for 8. Okay? So minus points for them also. Wrong. Over. Okay. So we are not considering. Only 8 minus 10 it is. Okay. Next. 7. 7 participant, right? Yes.
Yes, ma'am.
Soumya, next. For you, I will start now. Just a minute. So this is explained, retroorbital pain and all, cavernous sinus. Your time starts now. Pounce opens.
Ten seconds over. Pounds closed.
Pounds closed. Your time starts now.
Ma'am, it is pelvic inflammatory disease with Weiling string adhesions that are formed. That photo.
Due to, what's the name of that?
Chlamydia.
Due to, what is it fully called?
Fitzhugh-Curtis.
Yes, good, very good. You got the answer right, Soumya. Okay, so we have many pounces in this. 8, 10, 4, 3, 6. All got it correctly. So plus 30 for you, for all of you. 12 has answered wrongly, minus 10 for you. Okay, so very good, Soumya. Others also. It was an easy question, I believe. Was it? Okay. No. Perihepatitis, pyosalpines, chlamydia, Weiling string adhesions. Over. Okay. Number 8. Participant number 8.
Yes, ma'am. Yes, ma'am.
Plus 20 for Soumya. Okay. 8.
Yes, ma'am.
Vaibhav.
Yes.
Mute. So your question, when I tell start, you start the time. Okay. Starts.
Ten seconds over.
Type answer if you know.
Pounds closed.
Pounds closed. Vaibhav, your time starts now.
Ma'am, is this Creutzfeldt-Jakob disease, CJD?
Very good. Okay. We give you 20 marks. Okay. 7th had pounced and he got it correct. Right? So 7 plus 30. Okay. Amit, right? That was Amit. Okay, fine. Next. Shall we go to 9?
Yes, ma'am.
Yes, Venkatesh. So this you answered correctly. MRI findings were there. There is hyperintensities in parietal cortex, thalamus, and all that. Myoclonus. It was an image of prion protein. One was normal, another was beta plated sheets, and that was a brain biopsy needle. Okay. So Venkatesh, we will start with you now. No, don't unmute. Your timing. Wait a minute. There is some disturbance outside. Okay. I shall display. Okay, start. Pons opens.
Ten seconds over. Pounds closed.
Pounds closes. Closed. Pounds closed. Venkatesh, your chance. Venkatesh.
Is this Lennox-Gastaut syndrome?
Time up. Time up. It was not exactly Lennox-Gastaut syndrome. It was West syndrome. Okay. It was jackknife infantile spasm with Salam spells, EEG showing hypsarrhythmia, and the drug of choice was ACTH. So it was written. So we have many pounces in this. 3, 12, 8, 6, and 1 participant plus 30. 3, 6, 12, 8, and 1 correctly. 5 and 2 wrongly. Minus 10 for 5 and 2.
Ma'am, I answered it as West syndrome.
Huh?
Tuberous sclerosis is associated with West syndrome. That's what I wanted to answer.
Syndrome. No, the answer was West syndrome, which we wanted to ask. I know that it is tuberous sclerosis. No.
Ma'am, I answered West syndrome within the time, and for the previous participants also, to the person who the question is directed, they are allowed to answer on prompting 1 to 2 times.
So no, first answer only we are taking, Arush. First answer which you type, we are taking. Like that, if we keep doing, we have many things to solve here. Okay? No. First answer which you type will be the only answer which will be considered. Please. The time to the question to whom it is directed, I will give chance because it is no negative marking and he has the right to answer to that question. Okay. Okay. Then next will be. Shall I go ahead? Are you okay with the marking? Question number 10.
Yes.
Participant number 10. Okay.
Yes, ma'am.
See, please type only one answer. Next. Your time starts now. Pounds opens.
Ten seconds.
10 seconds.
Pounds closed.
Pounds closed. Closed pounds. Ashmita.
Spoon belly syndrome.
Okay, Ashmita, you get it right. Plus 20 for you. Many have pounced and they have pounced it correctly. Okay. 2, 3, 6, 8, 9. All of them have pounced it correctly. 2, 3, 6, 8, and 9. Plus 30 for them. Anyone? Yes. Ashmita? It was a prune belly syndrome, absence of the stomach muscles with undescended testis and the urinary tract abnormalities with vesico-ureteric reflux. Okay. So, okay. So, participant 11?
Yes, ma'am.
For 1?
Yes, ma'am.
Sure, I will start for you. Okay, mute. See, all of you are ready? Yes. Pounds opens.
Ten seconds over. Pounds closed.
Pounds closed. For 1. Pounds closed.
Infantile hydrocephalus.
What?
Hydrocephalus.
No. What is the condition? We are asking the condition. Hydrocephalus is the image there.
CRA malformation.
No. Time up, Pavan, you didn't answer it correctly. No negative markings for you. But we see, if you know the answer only, then type pounds. Or else you can just not pounds and don't get negative marking. So 3, 8, and 10 pounds, then it was a negative marking for them because all of them got wrong. 3, 8, and 10. What is this if you want to take a guess?
Ma'am, is it a Dandy-Walker malformation?
Illa. No, that's what he said already. No. Okay. All of you mute. It was a neurocysticercosis. This image you can see there arrow we had put here. And this was a larval image, histopathology of the larva. And this was a hydrocephalus. It was a neurocysticercosis image. Okay. Next, participant 12. Participant 12, you have to tell the condition. Just don't tell me what is there displayed in the image. Okay. So, 12 participants.
Yes, ma'am.
Okay. So, time starts. Pounds opens.
Ten seconds
over.
Pounds closed.
Pounds closed, Shiveha. Your time starts.
Ma'am, is it Smith-Lemli-Opitz syndrome?
What?
Smith-Lemli-Opitz syndrome. Ma'am, there is midline defects, sonic hedgehog gene. Ma'am, cyclopia.
Correct. Whatever you are telling is correct, but what time? Your answer is wrong, Shiveha. Okay. It's not related to that.
Okay.
Whatever your condition is, whatever you have told, the things are right, but the condition is not okay. It is an image of, shall I tell? How many have got it right? 10, 8, 4, and 3 have got it right. 3, 4, 8, 10. No? Sorry. 3, 4, 8, 10 have got it right. 6 has not got it right. Okay, 6 minus 10. So the answer was holoprosencephaly. in Patau syndrome. Holoprosencephaly also, if you had told me, I would have considered yours. So we are not giving you marks, Shiveha. Okay. So at the end of quarterfinals, is there a tie? We have to calculate. Give us some time. You can take a break of 5 minutes. I will stop.
Excuse me, ma'am.
Yes.
Ma'am, the connect for this, ma'am, holoprosencephaly and cleft lip and cyclopia, ma'am, they are found in Smith-Lemli-Opitz syndrome also. So, ma'am, can the quiz masters look it up once and decide if I should be awarded marks or not? Because it is even more of a specific answer than holoprosencephaly.
Please type it in the chat box. The name of the disease.
Yeah, ma'am, sure. Ma'am, to the pounds person.
Quiz master, please. And sorry, to the query person.
Okay.
Ma'am, isn't Smith-Lemli a cholesterol dehydratase mutation and not sonic hedgehog?
But since it has holoprosencephaly and the gene that is responsible for matlab midline wala pura arrangement is sonic hedgehog gene only. So its cases can have a matlab malfunction of this gene also. क्योंकि मतलब जो sides का determination it is caused by sonic hedgehog. तो all midline gene defects में it is usually involved.
We'll look into it and let you know.
Okay, ma'am. Thank you.
So all participants are there. Before I announce the semi-finalists, yeah, announce semi-finalists. There was a query, it seems, but Shiveha, we have verified it's not right. So that's not the answer we were looking for also, and it's not right. Okay, so we will be announcing the scores. Participant 1 is 80. Participant 2 is 20. 3 is 170. 4 is 120. 5 is 10. 6 is 120. 7 is 60. 8 is 160. 9 is 30. 10 is 70. 11 is 20. 12 is 130. So there is a, we are qualifying 8 participants for the semi-finals. So participant 11, 9, 5 and 2 can exit. Thank you for your participation, participants. Good luck for your next time. Okay. Participant 2, 5, 9 and 11. I have told the scores. Okay. So we have participant 3 leading 170, participant 8 160, participant 12 130. Okay, is it clear? Are they there? Okay. Can you switch on your videos? Are you there?
Yes, ma'am. Yes, ma'am. We'll switch our
All
videos.
of you are there?
Yes, ma'am.
Yes,
Because
ma'am.
I told.
Yes, ma'am.
Yes. So I will ask participant 1. Are you present?
Yes, ma'am. Ma'am, I have a doubt.
Participant, no doubts. Participant 3. 3.
Yes, ma'am. I'm
4.
there.
Yes, ma'am.
6.
Yes, ma'am.
7.
Yes, ma'am. Present, ma'am.
8.
Yes, ma'am. Present, ma'am.
10.
Yes, ma'am.
12.
Yes, ma'am.
Okay. Who has a doubt? Shivam, tell me.
Ma'am, will the scores? Ma'am, hello. Will the scores be carried forward
Yes.
for the subsequent? Okay, ma'am.
I am carrying forward the scores. Because this whole quiz, it's a whole quiz. Every question how you answer in all the rounds matters.
Ma'am, have the scores
final
been announced?
Huh?
Have the scores been announced?
Yes, you are not there, beta.
Yes, ma'am. I was not there. What is my score? I don't know.
6, I think 1, 2, 3, 4, 5, 120.
Okay, ma'am.
Okay. So should I read out the score? 180, 3 170, 4 120, 6 120, 7 60, 8 160, 10 70, and 12 130. Is it okay?
Yes, ma'am. Thank you.
They have exited others. 2, 5, 9, 11. They can watch on YouTube, right?
They can also see as an attendee.
No. It will create a problem. 2, 5, 9, 11. You can please log in through the YouTube. You please go to the YouTube channel and log in because you have said it has been sent to them. The link has been sent for the YouTube.
Yes.
I will send.
Yes, please send again. Please send the YouTube link to them. Huh? The YouTube link has been shared with other participants and other audience, our college. Huh?
Ma'am, how many
Yes.
will qualify to the finals?
4 half. Okay.
Okay, ma'am.
So it's a tough competition. I want you to participate aggressively now in this because it will be deciding, but I am carrying forward this course.
Ma'am, how many rounds like we'll have for like semi-final?
Yes.
Like only
I'm
one?
going to tell you all this now.
Okay, ma'am.
For the semi-finals, I am going to tell you the rules and regulations. Okay. So, should we ask them to show around again? We want you to show around again. Our monitors who are watching you will be seeing. Please show around your rooms, surroundings, because one by one, participant 1. Because since we don't want any malpractice, it is being done so. 1, 3, 5, 7.
Ma'am, here, I'm showing that.
Yes, you please show. We will rename them now. Yes, we will get again 1, 2, 3, 8 we will give them. Yes.
We can use the correct orders.
No. We'll rename. We'll rename according to the marks now. One down. Just a minute. So around your surroundings, next participant. 1, 3, whatever, whoever were there. 1, 3, 5.
I'm already at that.
Yeah, please, others, please, the surrounding who are checking, please check around. 11, 12, 10, then who else? 8, 7, 6, all this, please show around. Have you confirmed? Have you confirmed monitoring? The ones who are monitoring, have you confirmed? Everything okay? Yes. Okay. So we are reassigning you the numbers randomly. Okay. So we are reassigning your participation numbers randomly. So I want you to change the participant number P, whomever we get now. So I will change your participant. We are using the app to reorganize, shuffle your participant numbers. Okay. Not by the marks wise, so that you have a chance. Done? Yes. Yes. So we are done with the rearrangements. So participant 1 will become 7 now. 1, 7. Write down their names. The list. 1 is 1. Okay. So 3 is 3 only. So 4 is becoming 1. 4 becomes 1. 6 becomes 4. 7 becomes 2. 8 becomes 5. 10 becomes 6. 13 becomes 8. 8. 12. Sorry, 12 becomes 8, not 13. Sorry. 12 becomes 8. So participant 1, can you tell me your name?
Amit, ma'am.
Huh?
Amit.
Amit. Please write his name. Participant 2.
Yes, ma'am. Soumya, participant 2.
Soumya. Okay. Participant 3.
Ma'am, Palak, ma'am. Palak.
Participant 4.
Lakshay.
Lakshay. Participant 5.
I'm Vaibhav.
Vaibhav. 6.
I'm Ashmita.
Ashmita. 8, 7.
I'm Shiva.
8.
Ma'am, Shiveha.
Okay, very good. See, now you still have, there are still 3 rounds now. Okay, after that it is finals. Again in semi-finals, we have pounds open. Okay, you still have chance. Okay, I will tell you for which round the pounds is open. So whoever has scored less also can get more marks. Okay. Shall we? Switch this off. Semi-finals, there are 3 rounds. Okay. Are we telling them? First, reasoning. Second is pure subject. Third is recent advances. Okay. So first is first round. Okay. First round is reasoning. I will tell you the rules. So a question based on reasoning will be asked to each participant. Participant should give the explanation using key terminologies. Okay. Total points for this round is 20 points. Quiz master will decide how good the answer is and score will be awarded likewise. So decision of the quiz master will be final. Pounds and bounds are not applicable in this round. Time allotted for this round is 60 seconds. Okay. Timer will begin after the question is read out. Okay. Participant 1. Can I have you? Participant 1.
Yes, ma'am.
Amit.
Yes, ma'am, I'm here.
Okay, Amit. So you have to tell me why, how, what happened, whatever. Like I'm asking you reasoning question. Okay. You have 60 seconds time. Okay. There is no negative. Is there any change? So this speaker is not on. It is. And it is not showing. Are you? Am I audible, Amit?
Yes, ma'am, you are, ma'am. Everything's fine.
There is some distance. It's charging. Okay. So Amit, we will go to the question. Anybody has any doubts?
Ma'am, no negative,
I'm
right?
not awarding any negative marks.
All right.
No negative. No negative. We just have to reason it out.
Okay.
Why is sorbitol used instead of water for a gastric lavage in patients with aluminum phosphide poisoning? Your time has started. Okay, you can think and answer.
Osmotic effect, ma'am, because of
Huh? Because of?
osmotic properties
No,
of
why it is not here? What will aluminum phosphide cause?
used instead
What
of
is used for gastric lavage? Huh?
ma'am because of
What will it release?
I'm sorry, ma'am, I'm not able to get your question, ma'am.
What will it release?
Ma'am,
What will it release?
phosphine
Why
gas, ma'am,
water is not used for gastric lavage?
phosphine gas, ma'am.
Yes. So what happens? Huh.
Ma'am,
What is used for? What
on
is
coming
used
in
for?
contact with water, ma'am, phosphine is released, ma'am. So instead we use sorbitol.
Yes. What extra can what else is also used in aluminum phosphide poisoning for lavage? Along with sorbitol.
Don't know, I'm not sure.
Yes, not clear, no? Okay.
Charcoal, ma'am, charcoal.
So I'll give you marks. Charcoal is used. Along with that, one specific. That is not your question though, but this is okay. If you know, you tell me.
Some
There is no
antidote.
negative.
Not sure, ma'am.
No. Okay, potassium permanganate is also used. Okay, for this aluminum phosphide poisoning. That is the first thing which we use for giving stomach wash. Okay. Okay. Question number 2 for Soumya.
Yes, ma'am.
20 marks to Amit. Okay. So it will get converted to phosphine gas, which will cause further damage. 2. Can you mute Amit?
Yeah, sure.
Do you have somebody with you, Amit?
No, ma'am, no, ma'am.
When you are smiling, seeing someone, right?
Phone only, ma'am. I'm using my phone.
Okay. Shall I? Question 2. Soumya,
Yes, ma'am.
why does orthostatic hypotension increase in prevalence with age? Time starts now.
I think there is more autonomic dysfunction, which increases in prevalence with age.
No, but what exactly happens? Okay, autonomic dysfunction, but what exact autonomic dysfunction?
Ma'am, the sympathetic supply which maintains the blood pressure. The baroreceptor reflex that might be blunted.
Yes. Okay. Anything else?
Yes, ma'am, the baroreceptor function and the autonomic reception, ma'am, all that have a prevalence to
I
get
will give
blunted
marks,
with
don't
age.
worry for that. But if you know anything else, you tell me.
No, ma'am. Ma'am, also diabetes and all, its prevalence also increases with age. That also can contribute.
No, not just that. Reduced baroreceptor reflexiveness, responsiveness, that is right. Cardiac?
Ma'am, I cannot get you.
Any cardiac changes?
Ma'am, response to catecholamines and sympathetic surge might be blunted.
Decreased cardiac compliance is there. Okay. And also attenuation of the vestibular sympathetic reflex. Let me give. Not happy? Okay, I'll give full marks. No issues, 20 marks.
Okay, thank you.
Next, 3.
Yes, ma'am.
Palak?
Yes, ma'am.
Okay. Question, I will start after the completion of question, your time starts. Okay. Despite both being extra parenchymal restrictive lung diseases, okay, why does the ratio of residual volume by total lung capacity show an increase in myasthenia gravis, but it remains normal in chest wall disorders like kyphoscoliosis? Which what I am asking is, RV by TLC increases in myasthenia, but not in kyphoscoliosis, though both are extraparenchymal diseases.
Okay, ma'am.
Starts now, type.
Ma'am, in case of myasthenia gravis, ma'am, being an it will be more likely affecting the respiratory muscles, and especially the diaphragm, which will decrease the total lung capacity. So that will help. That will definitely increase the ratio. So that kind of.
In chest kyphoscoliosis also, it will affect the.
Ma'am, but it will not affect the muscles as such, because it will be more like it will be affecting the chest cavity size, but as such, the ma'am. Plus, there is like the ratio will be maintained in case of kyphoscoliosis because of the maintenance of the RV and TLC.
RV?
And the TLC, like both decreasing, that kind of maintains the ratio. So in case of kypho,
Why?
Ma'am, because there is like kypho, like because there will be variation in the chest, like cavities, like symmetry will be different. So that kind of compensates.
I will give 10 marks. Huh?
He answered correctly.
No, I will give 10 marks because we have asked why does the ratio of RV by TLC shows an increase in myasthenia gravis. Why was the question, right?
So, ma'am, because of
that increase in denominator and decrease in denominator is not the answer. Why is the answer?
Ma'am, because the muscles.
No, that's what I'm telling you. What you answered is half right. 10 marks.
Okay, ma'am.
Because what happens in the kyphoscoliosis, lungs are not involved. Lungs are involved. Even the repeated infections will happen. Lungs are involved. So the residual volume decreases.
Okay.
Eventually. And in the myasthenia gravis, residual volume will remain same.
Normal.
Because the lung parenchyma is not involved.
Okay, ma'am. Yes, ma'am.
Okay. Am I clear?
Yes,
I will give 10 marks for you. Okay, 10 marks.
Okay, ma'am.
4 participant 4.
Yes, ma'am.
Lakshya. Okay. So that was the explanation. I am not reading it out again. I have explained. Lakshya, your question, olanzapine is an atypical neuroleptic drug. It is used in cancer patients. Why? Particularly it is used. So I want a reason why. Starts now. If you know anything, you can answer.
Maybe to reduce the nausea and vomiting in the cancer chemotherapy patients.
So, what is that?
Nausea vomiting.
It decreases nausea vomiting. What else? So why is it used in cancer patients along with that?
Because in cancer chemotherapy, when chemotherapy is given, nausea and vomiting is quite common.
That is true. Why? How it does? You can tell me.
And by blocking the 5-HT receptors.
No. So I will give half marks. 10 marks for you. But the expression exactly is, it corrects the acetylcholine insufficiency and also reduces agitation and improves the sleep, and also helps in improving delirium, and it also decreases nausea vomiting separately. That is why it is used in cancer chemotherapy patients. Okay. So I'll give you 10 marks. Okay, Lakshmi. So fifth participants. Okay. Participant 5, can I have you on?
Yes, ma'am. Am I audible?
Yes. Vaibhav. So mute. So next question to you. Majority of surgical abdominal conditions are well diagnosed and followed up by CT scan. So we always order CT. But MRI is the preferred imaging modality for inflammatory bowel disease, especially like Crohn's disease. Okay. So we use MRI in Crohn's disease. Why? I want the answer. Okay, your time starts now. You can unmute and answer.
Ma'am, like early findings of Crohn disease, like aphthous ulcer and everything, and soft tissue changes are more better appreciated in MRI, because in CT scan we prefer when we are looking for any calcification or something like that. But here nothing like that is happening. So early soft tissue changes like aphthous ulcers and all the strictures and
Not aphthous ulcers. Okay, strictures. Yes.
strictures, pseudopolyps, and for all these soft tissue findings, MRI will be a better modality for diagnosis compared to CT scan.
Okay, I will take your answer. Okay, but one more thing, can you add? Like anything? Why not? If we keep on doing CT, what will happen?
I mean, CT scan, maybe if we use contrast, then maybe it will hamper the gut, which is already damaged, maybe.
No. Multiple repeated exposures to radiations. Okay.
Radiation exposure is much more in CT scan.
Okay, 20 marks to him. Okay, question number 5. Vaibhav, right? Vaibhav, 20. Okay, next. Correct, it is Vaibhav. We wanted a specific delineation. CT is more helpful in some things like bleed or something like that, or infections. Okay, here it is polyps and all, strictures. Next, Ashmita.
Yes, ma'am.
So, I will ask you now a question. It is seen that most of the patients undergoing radical rectal excision for carcinoma of rectum or radical hysterectomy, they land up with bladder dysfunction. Okay. So why is it so? Question time starts now.
Ma'am, iatrogenic injury to the sphincters of the bladder, specifically the internal sphincter, during the excision.
Sphincter is where? Sphincter is in the bladder.
Yes, ma'am. And rectum and hysterectomy, like they are all in the pelvis in a very narrow space. And there when we are excising, so iatrogenically.
Injury to which neurological structure, I can ask you?
Ma'am, or injury to the sacral plexus.
Which
nerves.
Which one?
Ma'am, the parasympathetic. Basically, the nerves are all mixed up. So it will not specifically injure the parasympathetic, but the sacral plexus of nerves which innervates the bladder.
Name, can you tell me? That is fine. Okay. Name.
Sacral plexus, like a name.
Name, can you tell me?
Pudendal, no, but pudendal will not affect here. Or
okay.
And the sacral parasympathetic plexus specifically,
understood. Yeah. Okay. Okay. Answer is half right. Okay. What you answered is half right. Okay. So I'll give 10 marks to you. It damages the inferior hypogastric plexus. Okay. Which gives both parasympathetic and sympathetic afferents to the bladder. Okay. Which will lead to the neurogenic bladder dysfunction. Half right it is, so I'm giving 10 marks. So participant 7, Shiva.
Yes, ma'am. Yes, ma'am.
Okay. I will ask a question now. You have to answer me why. So your question starts now. Why does the dent disease present with low molecular weight proteinuria? Why it is only low molecular weight proteinuria in Dent's disease. If you know, answer starts now.
Ma'am, in Dent's disease, we'll have tubular injury. Because of tubular injury, we can have low molecular weight proteinuria. Albumin and transferrin, albumin and transferrin will be eliminated. Ma'am, it will present with tubular disease. It is a tubular disease. Tubular
Okay,
injury.
but what exactly happens so that there is low molecular weight proteinuria?
Ma'am, tubular reabsorption is impaired. Ma'am, the tubules are injured, so they might present as protein.
Why specifically low molecular weight proteinuria was the question? Because tubules are impaired, time is up. Tubules are impaired, any proteinuria can happen. Why only low molecular weight proteinuria was the question. Okay, so there is an impaired acidification of, no marks for him, endocytic vesicles because of mutation in the chloride channel genes, okay, which causes low molecular weight proteinuria in Dent's disease. Okay. Next, Shivya, participant 8.
Yes, ma'am.
Okay. So the question for you, Shivya, why is it emphasized to avoid steroids before biopsy when primary nervous system, central nervous system lymphoma is suspected? I need the reason why it is avoided. Steroids are avoided. Time starts now.
Ma'am, primary CNS lymphoma is a disorder that occurs more commonly in immunocompromised people. So, ma'am, steroids can further worsen the immunocompromised state, possibly. And ma'am, that might be a reason, possibly.
No, it is not the right answer, Shivya.
Ma'am, the steroids might, ma'am, they might affect the biochemical composition, which can be used for a diagnosis in this case, due to some immunomodulatory changes.
Specific reason why it is avoided. Okay. Okay. So time is up, Shivya. That is not the answer. No marks to you. Okay. So that is because they have a cytolytic effect on the lymphoma cells. Okay. And it leads to the non-diagnostic tissue. And it will give a false negative result. Okay. If you use steroids in the primary CNS lymphoma. Okay. So that completes our 8 participants with 8 reasoning questions. Should I tell the score or at the end? I have told anyways for them the scores whenever they were going through. So I'll go to the next round. Okay. The next round is pure subjects round. I will tell you the rules and regulations now. So this is a direct question round. Time limit for each question is 60 seconds. It will begin after I read out the question. Okay. So each participant will receive 20 points for every correct answer. Okay. So my decision will be final. So there was a pounce, right? Next round. Okay. We have just a minute. So can I have the participant 1?
Yes, ma'am. I'm here, ma'am.
So did you understand? There are no negative markings in this.
All right.
Okay. But I will need a specific answer. Okay. There is a specific question. Specific answer. When I complete whole question. If there is an email and everything, after everything is displayed, I will tell your time starts now. Then you, from that, there is 60 seconds. In this, there will be no prompting, no reasoning, no helping. I was in the reasoning scenario, it was like a discussion. I was helping and prompting, okay, for each participant. This is a particular question. So, are you ready, Amit?
Yes, ma'am.
Yes. Okay. So, a 22-year-old man presented with palpitations and chest pain to the medicine OPD. He reported previous episodes of on and off constipation and diarrhea from his school days. He said that he has blackouts when he stands up suddenly or when he does strenuous exercise. On general examination, he had moderate impairment in comprehending questions asked to him, although he was a very attentive and responsive person. Okay. So patient exhibits syndromic faces, which I will display. On examination, BP was 130/90 mmHg in the right hand. And in the left hand, there was 100/80 mmHg in the left hand. Okay. But on auscultation, there was a systolic murmur which was heard at the right upper sternal border, okay, which is radiating to the right cervical region. Okay. So which chromosomal abnormality causes this condition? I am not asking you the condition. Please note, I am asking you the chromosomal abnormality which causes this condition. That is the answer which I need. So I will display the image. Okay. So this is the person. Your time starts now.
From 7th chromosome. Deletion.
Yes, very good. What is this syndrome?
Williams syndrome.
Yes, you got it right. Okay. So plus 20 for you, Amit. Next, participant 2.
Yes, ma'am.
Soumya.
Yes, ma'am.
Your question starts now. This is correct. He answered correct. Chromosome 7. A 7-year-old child comes to the OPD with complaints of blood vision. On further investigations, dark adaptation and electroretinogram are normal, but the EOG, electrooculogram, is abnormal. Fundus examination reveals the following findings. Which protein dysfunction is responsible for this condition? Which is a protein which is responsible? Okay. Starts now, time.
Ma'am, it is best disease. Ma'am, a protein which is responsible for the retinal pigment epithelium. That is responsible.
Name? Protein dysfunction, I am asking.
Best vitelliform dystrophy it is called, ma'am.
Yes, you are correct. But I want the protein name.
Best one protein.
Yes, little modification.
Ma'am, best one protein which is misfolded actually.
Yeah, you know the topic, but little modification in that. I will award marks for him. But
I'm exactly not remembering, but it is best one protein. I have read something like that. It is best one protein which has that egg yolk appearance, that classical which is seen in this fundus.
Okay. Time up.
Bestrophin protein.
Huh?
Bestrophin protein or best one protein?
Yeah, bestrophin. We have a doubt that you are doing a malpractice now. Are you typing?
Ma'am?
Are you typing it out?
No, ma'am. No, ma'am.
Huh?
No, ma'am. No, ma'am.
Like disclose now.
Yeah. Can you go back?
Yes,
ma'am. Your face is full.
Yes, ma'am. Yes, ma'am.
Actually, we can't see what are the frame. This kind of evidence.
We have a query regarding you now. I will give half marks for it. Okay. because I have to prompt so much for him. Okay. Please, no, nobody is visible.
In the previous rounds, there was
10 marks I will give. Yes.
Ma'am, but I told the protein that one best one initially, best one or bestrophin. From the same protein it is.
Yeah. Am I audible? Yes. Soumya, can you sit
Yes,
a
ma'am.
little back with both your hands visible? How the touch?
Ma'am, is it visible both?
Shiveha and Ashmita are sitting with your hands locked like this. Okay.
Okay, ma'am, I will sit like this.
Okay, but I will give you half marks, Soumya, because I had to prompt you so much for the bestrophin answer. Okay.
Ma'am, but best one is also correct. Best one.
No,
protein
that
also
is the best one is not correct. Bestrophin one is the protein. Okay, best disease it is.
Okay,
Okay.
ma'am.
Okay. Then
Okay.
next third person.
Yes, ma'am.
Okay. Falak.
Yes, ma'am. Yes.
Is it please? Next. Okay. Question number 3, Falak, to you. A 6-month-old baby boy presents with symptoms of cloudy cornea and gingival hypertrophy. On inspection, his facial features are abnormally coarse. He has no neck control and is unable to roll over. Lab investigation shows markedly reduced activity of N-acetyl glucosamanyl 1 phosphotransferase in WBC. It's very specific. UDP N-acetyl glucosamanyl 1 phosphotransferase in WBC. What will be the pattern of inheritance? I am asking, not the disease.
Okay, ma'am.
What will be the pattern of inheritance of this disease?
Okay, ma'am. It's mucopolysaccharidosis with all the findings, and it is. I'm actually confused, but I'll be going with the answer of
Answer of
X-linked recessive, ma'am.
X-linked recessive. You want to go ahead? Okay.
No, ma'am. Can I just?
60 seconds. You have time.
Okay, ma'am.
One final answer. 20 seconds.
Okay, ma'am. Ma'am, X-linked recessive, ma'am. Autosomal recessive. Final answer. AR.
Final?
Yes, ma'am. Final answer, ma'am. I'm very confused, ma'am.
Okay. Okay, I will give you marks. It's an autosomal recessive disorder.
Yes, ma'am.
Okay, it is same what you have told. It is a type of polysaccharidosis. Okay, eye cell disease, right? Yes. Autosomal recessive inheritance. Okay. 20 marks to me. Next.
Ma'am, I had one doubt, ma'am. No, ma'am. Actually, ma'am, I have to catch a flight, ma'am. So, can I like call my cab person? Meanwhile, the other persons are like.
Yes. We understand the things are happening,
Okay.
but we can go ahead with the next participant. 4. Participant 4.
Yes, ma'am.
Lakshya, are you there?
Yes, ma'am.
Okay. So this is autosomal recessive eye cell disease. It was okay. Next, a 20-year-old male presented to ophthalmology OPD with painless, slowly progressive blurring of vision affecting the central visual field of left eye. Okay. Pupillary reactions were normal, and following findings were seen on fundus examination. Okay. Whatever the pic is there. What is the mode of inheritance of this condition? Time starts now.
Mitochondrial inheritance.
Okay, I'll give you marks. What is the condition?
Ma'am, I just forgot the name of the condition. Some FT gene. I just forgot the name. I just remember that it's related with it is in the topic of CRAO and all related to that.
Okay, mitochondrial inheritance is right. It is a Leber's hereditary
Leber's hereditary optic neuropathy.
Optic neuropathy. Okay. Okay, fine. So I will go to the next person. I'm going quick in this. 5th. There is no explanation needed here. Vaibhav?
Yes, ma'am. Am I audible?
You can. We can ask him also to tie your hands. Okay. Even the last person, Lakshya, also. Okay. So next, Vaibhav, I will ask you the question now. Are you ready? 35-year-old female presented to the dermatology OPD with history of loss of hair over the scalp, shoulder, pubic region since 4 years. Okay. She also complained of small pigmented lesions over the abdomen, trunk, thighs, and forearm. History of itching over the pigmented lesions with mild scaling over the scalp was present. On inspection, scalp and abdomen revealed the findings shown in the given image. I will show you the image. I want the diagnosis because it is split in two. I am taking time to tell this. I want the total name of the condition, full name I want. Okay. So 35-year-old with this image. Time has started, okay? Attempt.
Is this something related to SLE, systemic lupus erythematosus, or DLE, discoid lupus erythematosus, something like that?
I can tell it is no. You can give one more answer. What is the diagnosis?
Can I see the question once? The main question
Yes.
type.
Last 5 seconds. Answer something.
Tinea corporis.
Okay. No, it is not. So this is Vaibhav, right? No, Vaibhav, it is not that. So it is something. It is something of lichen planopilaris. Okay. So that is a cicatricial. It was way beyond. Okay. So the name is Graham Little Picardy Lazar syndrome. Even if you had answered in that what condition it is lichen planopilaris, I would have given you marks. Okay. So no. Okay. Question number 6 to the participant 6. Shivam. No, Ashmita.
Yes,
Ashmita.
ma'am. Ashmita.
Ashmita.
Yes, ma'am.
Okay. A 65-year-old retired officer has been confined to his house since COVID-19 pandemic began. He does not have any visitors and has lost touch with his family. He has persistent feeling of low mood and sees no purpose in life. He sometimes has thoughts about killing himself. Right? What are the most likely sleep changes seen in this condition? Sleep polysomnography findings I want, or sleep related changes, what happens in this disorder. Okay, in this psychiatric disorder. Time starts now.
Ma'am, he is suffering from depression here. So there will be insomnia because of that. And sleep changes. He can get delusions.
Sleep polysomnography findings I am asking. Anything which happens to the different sleep patterns, sleep cycles.
Ma'am, the REM duration will increase and the NREM will decrease.
Exactly.
Yes, ma'am. The REM will increase and the NREM will decrease. I don't know specifically which phase of NREM.
Okay. The answer is half correct and half wrong, actually. So it is 10 marks to you. Since detailed answer was not given by you, but what you have said is correct. It reduced REM latency and deficit of deep slow wave sleep was the answer. But what you said is also right. NREM will decrease and REM will increase. Okay, 10 marks to you. Next, Shivam.
Yes, ma'am.
Okay. Hands.
Ma'am, I'm holding there. So I'm holding the iPad with my hand. If I leave, it goes like this.
No. Don't your face to be seen. Okay, I'll ask you a question. So, what is the depth of involvement of myometrium by the placenta in the condition diagnosed from the image below? Okay, this is the image, ultrasonography image. So where the placenta is invading, involvement of myometrium, or what happened?
Ma'am, beyond the Nitabux layer.
Huh?
Beyond the Nitabux layer, NITABUCH. Beyond the Nitabux layer. Placenta, epitheta, and perfita.
What you are telling? Beyond the
Nitabux layer, Nitabux. NITABUCH. Nitabux.
Okay. Correct it is. So it is what is this condition called?
Ma'am, placenta accreta.
Placenta. Little modification.
Yeah, it's also known as, ma'am, morbidly adherent placenta because
Yes, that is there. But what you told, that first answer was right only. But this is called as placenta?
percreta.
Yes. 20 marks. Next. Shivya.
Yes, ma'am.
Okay. Right. A 45-year-old male patient hailing from Patna comes with complaints of hyperpigmented macules over the trunk and face. The nurse and the sensations are found to be normal, and there is no visible scaling. The patient gives a history of prolonged fever 18 months back, okay, for which he was treated. What is the drug of choice for this condition? I want to know the drug of choice for this condition. Your time starts now.
Ma'am, so the condition is probably post-Kala-Azar dermal leishmaniasis, and ma'am, the drug of choice is paromomycin. Ma'am,
correct, it is what you said was okay, but what do you use for Kala-Azar?
Ma'am, Kala-Azar ke liye the drugs we use are amphotericin B and
yes, amphotericin B and if you know, you ask.
stibogluconate compounds.
That is that old it was.
Miltefosine.
Yes,
also.
yes, very good. Okay, fine. 20 marks. Fine. Okay, so this round is over. Next round, we'll move on. I will tell the marks finally in the last round. Okay, so okay. Next, shall we go on? Everything. The person who wanted to call cab fellow.
Ma'am, actually, ma'am, I'm in the meeting only, ma'am. Yes, ma'am. I called.
Are you fine? Shall we go to the next round?
Yes, ma'am. Sure, ma'am. Sure, ma'am.
Ma'am, can we have the scores once, please?
You want the scores? I will tell you total this round scores. No, total number. Okay. Participant 120, 210, 320. Okay, 420, 5, no, 6, 10, 7, 20, 8, 20 for this round. This is the quarter. Previous round? At the end of semi-finals, I will tell total marks. All okay? Shall we go to the next round? Yes. So in this round, we are having a pounds. Next round is recent advances. So you want a break? I am not giving break now. I will give after this round, reset advances. So gear up. You have a chance to score marks now. Okay. So this is over. So round 3 is recent advancements. It's a very difficult round, which I felt. Okay. Okay. So if you know the answer, only then counts. Don't go into negatives. Even if you don't answer, it's fine. For the person whom I'm asking, I'm not making any negatives. Okay, there are no negatives for the person to whom I'm asking. So if at all, even if no, you have one question to answer to get 20 marks. But please don't pounce if you do not know the answer. Because in this is the last round of this semi-finals, which will decide your entry into finals, where we are taking only 4 finalists. Okay, so round 3. First participant, can I have you?
Yes, ma'am, I'm here.
I'm not going to explain query, what is this reference, nothing in this round. Okay, this is the answer and no prompting. I will give the marks, the time, and the time limit is very strict because it is a pounds rule. Pounds. Everybody please. But how can they? They can't. The person answering. The person answering, Amit? Your audio is off. No.
Oh, I'm holding my phone, ma'am. Same issue as with Shivam.
Okay. Okay, a little far away can you hold? Because I'm going to answer, I'm going to ask you only this question. Other people can pounce. So pounds person, you can have to exactly calculate. When I stop the question, then the pounds time starts. Okay, 10 seconds. I will say, he will say 10 seconds. After 20 seconds over, pounds closes. Then I'll ask you the question. Okay, Amit? Mute.
Yes.
You want to check once whether they are better. See, sorry. Can you just type AAA, Amit?
Yeah, sure, ma'am.
1, 2, 3. First one, type AA.
Just did, ma'am. I just did, ma'am.
Not come.
I just did, ma'am. Did you get it now?
No, Amit.
Is he texting pounds?
Pounds only? Are you?
Yeah, I'm texting pounds only, ma'am.
Second person?
Ma'am, it shows that pounds is not in the meeting when I'm typing.
Oh, yeah. I just sent it again, ma'am. Did you receive it now?
Yes.
Just a minute. Then we will restart. Can you send it again, Amit?
I just did it again, ma'am.
Yes, it came. 2. Soumya?
All of them should actually send it to pounds again, ma'am. That is what I did. I think pounds left the meeting in midway, so something happened. So they should press on pounds again and send again.
Okay.
I sent it, ma'am, now.
3. Falak.
Yes, ma'am. Yes, ma'am.
4.
No, 3 we didn't get.
Ma'am, did you get it?
3, 4, 5 we got. 6.
6. 7.
7.
Got it. 8. Got it.
Okay. So everybody is, we are getting. Okay.
Ma'am, did you get the response from 3, ma'am? The number from me,
Can you resend again, Falak?
Ma'am, I've sent it right now, just right now.
Yeah, got it.
Okay, ma'am.
Yes. So not much time left. Okay. Participant 1, Amit. I will tell. Each participant will get 1 question about recent advances and developments to which they have to answer in the given time. That is 60 seconds total. Okay. The timer will begin after the question is read out. Each participant they will receive 20 points for every correct answer. There is no negative marking for the participant. Okay. Pounds is applicable for this round, which I have cleared now. Okay. My decision will be final. Next. Shall I go ahead with the questions? Participant 1. Can I have you, Amit?
Yeah.
Okay. Mute. Please leave. Don't enter. Okay. So, question 1. Drug X, which was recently approved by FDA, is indicated for the preventive treatment of episodic migraine. Episodic migraine in adults. It works on a receptor which is 37 amino acid peptide, primarily localized to C and alpha delta, A delta sensory fibers. The most common adverse reactions are nausea, constipation, and fatigue. Okay. You have to just tell me the drug X for episodic migraine recently approved. Pounds starts now.
Ten seconds over. Pounds closed.
Pounds closes. No? No, sorry. We have time. 3 seconds, 2 seconds, 1 second.
Pounds closed.
Pounds closed. Amit, your chance.
I'm a Tojipant, ma'am.
Yes. So we negative marking for the pouncers 2 and 7. Answers are wrong. Auto captain plus first Amit gets plus 20. Understood? Okay. No mistakes. Huh? Next person, second person, Soumya.
Yes, ma'am.
You can go back. Okay. Soumya, your question. So Z is a radiation treatment for people who have a specific type of liver cancer called unresectable hepatocellular carcinoma. Okay. It consists of millions of microscopic glass spheres containing an isotope of yttrium. It is delivered to the cancer tissue tumor in the liver through a catheter in an artery. Okay. I want what is Z? What is that Z, which is a radiation treatment? What is it called? Pounds opens.
Ten seconds over. Pounds closed.
Pounds closed. Yes, answer, Soumya.
Ma'am, is it Therasphere?
Yes, your answer is right, Soumya. 20 marks to you. 195 pounds wrongly, 7 pounds correctly. 195 minus 10, 7 is plus 30. Whoever is 7. Ashmita. Okay. Oh, sorry. Shivam. Sorry, Shivam. Yes, fine. You got it correct. Plus 30. Next, 3. Participant 3.
Yes,
Falak.
ma'am. Yes, ma'am.
Okay. So Falak, mute. Yes. Then Therasphere is correct. Okay. X is approved by the FDA for relapsing forms of multiple sclerosis. Okay. Which includes clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease in adults. Okay. It is thought to act by promoting the retention of certain white blood cells in the body's lymph nodes, keeping them out of circulation and from entering the brain and spinal cord. Okay, basically it is concentrating the lymph nodes. I want to identify the X, which is approved. Okay. Huh? Participant? 8 pounds opens.
Five, 6, 7.
10 seconds up.
10 seconds.
Pounds closed.
Pounds closed.
Okay, ma'am. Can I hello?
Yes.
Ma'am, is it Fingoli mod?
Huh?
Fingoli mod.
No, something extra. New one which I am asking.
Okay.
Time.
Okay.
Time up.
Okay, ma'am.
Okay. Time up. Okay. No marks, but no negatives for you. All have answered wrongly.
Ma'am, but why is Fingoli mod wrong answer for this? Fingoli mod is FDA approved for this condition, and it precisely works by this very mechanism.
Yes, it is recently
Yes, ma'am.
approved.
Yes,
We are asking recent advances recently approved. Okay.
But Fingoli mod is not a wrong answer. Like, you cannot say that Fingoli mod is wrong.
I'm also in the question recently approved drug. It is not written also. So we thought about a drug, and Fingolimod is exactly the same mechanism.
Okay, who knows correct answer now? Tell me. Because it's a recent advances questions.
Can I get a shot at it, ma'am?
He's asking for
You can type it personally.
Okay, ma'am.
No, not for no. Marks is not allotted.
Ma'am.
No, marks is not allotted. It's a recent advances thing. I have not displayed the answer also. But Fingoli mode is not the answer for this because it is a recent advanced question.
Ma'am, what is the answer, ma'am, for this question?
It is for you only, no, Falak.
Ma'am,
Okay.
actually,
Ma'am,
ma'am,
is it
being-
helmetuzumab? Is it that?
Huh?
Ma'am, is it helmetuzumab?
No, fine. Nobody has found
Send
correctly.
the answer. Ma'am, is it Ozanimod?
Yes, 2567 have found it wrongly, -10, 2567. The answer is ponesimod. Okay.
Ponesimod. Okay. Ponesimod.
Okay. Next person, 4. Lakshya.
Yes, ma'am. Yes, ma'am.
Yes. Huh? No, we can't do that. Because you have to type pounds.
Ma'am, can we get no negatives for this because our answer was correct, means partially correct, because it was not a recent drug, but it has the same mechanism. Ma'am, pertaining to that, can we get no negatives for this?
No, since you pounced. No, -10.
Okay.
Next. Lakshya? No.
Yes,
Vaibhav.
yes, ma'am.
Lakshya. Okay, it is your turn. So please don't make any confusions here. It is X is an FDA approved drug, recent, everything is recent, which is used in the treatment of patients with HR positive, HER2 negative advanced breast cancer who had received endocrine therapy previously. It is a PI3K alpha specific inhibitor. Pons opens. It's correct. -10. Pons opens.
10 seconds over.
10 seconds over.
Pounds closed.
Pons closed. Answer, Lakshya. Any drug which you
Ma'am, I
know?
don't. No, ma'am, I don't remember.
Any answers are correct?
No, 2 is wrong.
2. Also, number 2 is wrong. Okay. So only number 2 has found it is wrong. -10 for him. This is he also didn't answer. Alpelisib is the answer. Yes. There is a query.
Ma'am, I had answered. Ma'am, I had answered idelalisib. I had read that. I don't know whether it is recent or not. It was wrong or correct?
No, wrong. See, Soumya.
Yes, ma'am.
Can you just show me your room? What device are you using?
Ma'am, I am using iPad.
Where is your phone?
Ma'am,
Where is your phone?
my phone is in my pocket.
That is what is the problem we are having now. You are not supposed to search when I am asking. Right? We have a query regarding you, or else I will disqualify you.
Okay, ma'am, I will completely place my hand like this. Only 10 pounds I will open it.
Okay, can you go back? Can you go back a little?
Okay, ma'am.
With your hands extended, weave is not correct, first of all.
Ma'am, is it okay now?
Yes. or else I will have to disqualify because we are monitoring it, and this is the thing which we can do in online. Okay, so there should be no malpractice. If I see next, if I have a doubt from any of my next last chance, I will disqualify you. Okay, this is the warning for all. Next, which one? Answer was different. Alpelicin. Okay. Next. Which was the next question? Vaibhav. Vaibhav?
Yes, ma'am.
Okay. Mute. See, no searching, only type AA. So this is a short question. Tivozanab, a kinase inhibitor, was approved by FDA for which condition? Pounds opens.
Ten seconds over. Pounds close.
Pounds close, Vaibhav, your chance.
Ma'am, is it for HCC or RCC, something like that, like Pazopanib we use? HCC or RCC?
Answer. Yes, I will give marks. Answer.
Ma'am, HCC or RCC?
Yes, okay. RCC is the answer. Okay. 20 marks. Pounds. One participant, one has answered correctly, Amit. Okay. 7 did not answer even after trouncing. -10. If you know the answer, only pounds. Number 6.
Yes,
Can I have number 6?
Yes, ma'am.
Ashmita.
Yes, ma'am. Am I audible?
Mute. Was there any malpractice again? No. Okay. FDA has recently approved 2 monoclonal antibodies for emergency use in post-exposure prophylaxis of COVID-19. Okay, for at high risk for progression to severe COVID-19. Okay, including hospitalization or death. They have approved 2 monoclonal antibodies for post-exposure prophylaxis. Name the drugs. Polls opens.
Ten seconds up. Pounds close.
Pounds close. Ashmita, your chance.
No, ma'am, I don't know this.
Okay. Anybody pounds? Pounds, has anybody answer? So many have pounds, huh? Okay. Yes. Yes. Okay, so 5 and 3 have pronounced it correctly, right? 5 and 3 have pronounced it correctly. Who are 5 and 3? Vaibhav and Falak. Okay, 1 and 7 have pronounced it wrongly. Amit and Shivam, -10. Okay, answer is, even if you have answered 1, I am taking Bamalanivimab and Atezolizumab. Okay.
Ma'am, I had also answered.
Huh? you didn't type A, it seems, right, Shiveha?
Ma'am, I did. Ma'am, yeah, I did.
You were reading the question, she wrote A.
She wrote a? Okay. Yes, we give her marks. Your A was before I read the question, it seems. It's okay, but because we are displaying the question, we can give you marks. Shiveha, you can get marks. Plus 30. Next. Last person.
No,
Shiveha?
it's my second one.
No, Shivam? Yes.
Yes,
Shivam.
my turn.
Okay. The question for you, Shivam, can you mute?
Yeah, ma'am. Yes, ma'am.
Okay, others, please. Selinexor is a selective inhibitor of nuclear export. The FDA approved it in July 2019. Works by blocking XPO1, a protein that allows cancer to thrive. Which condition is the drug approved? Count starts.
Ten seconds up. Pounds closed.
Pounds closed. Shivam, pounds closed. Shivam, answer.
Ma'am, is it used to treat multiple myeloma?
Yes, you get the marks. It's okay. Multiple marks. No, 20. Shivam, 20. Who have pounced correctly? Anybody has pounced wrongly?
1, 2, and 5.
Correct.
No wrong answers. 1, 2, and 5 have pounced correctly. 1, 2, and 5 have pounced correctly. Okay. Next. Shiveha.
Yes,
Refractory cases of multiple myeloma, I am giving marks. No issues. Next.
Yeah. No, not in this one.
Shiveha?
Yes, ma'am.
Yes. Okay. Next question to you. X is the first and only targeted complement component C3 therapy indicated for treatment of paroxysmal nocturnal hemoglobinuria in adults. Identify X. Count starts.
10 seconds up. Pounds closed.
Pounds closes. Shiveha?
Ma'am, the drug I know is eculizumab, but it is a C5 therapy. So I don't know the C3 therapy.
Okay. No issues. No issues, but everybody who has pounced is also wrong. 5 is right. Only 5 is right. Okay. I will tell you the answer. You can ask the query person the link. Okay. No issues for this research advances. Links will be given if you ask the query person. Okay. Pexatecoplan is the new therapy for C3 indicated. Only 5 has answered correctly. Who is 5? Vaibhav. Okay. 4, 7, 3, 1, 2 have answered it wrongly. It's minus 10 for you all. Okay. So we will need 5 minutes time to calculate your scores and tell you. Please be online. Don't go. Be online. Have a 10 minutes break because finals is going to be long now. Okay. Finals is going to be long. 4 rounds are there. But since only 4 participants, it will get over. But you can have a 10 minutes break. Not earlier, not later than that. Participants, all participants, are you there?
Yes, ma'am, we are here, ma'am.
All eight?
Yes, ma'am.
Yes, ma'am.
I will announce the scores now. Okay. Participant 1 is this.
Yes, ma'am, I'm here, ma'am.
Participant 2 is 40. Participant 3 is 50.
So tell my score once again, ma'am. Participant 1. I didn't catch you, ma'am. Sorry.
1 is 90. 2 is 40. 3 is 50. Participant 4 is 20. 5 is 110. 6 is 10. 7 is 30. 8 is 50. Queries among yourselves? You have any queries? Do you have any queries? Now we are going to announce the finalists, 4 finalists. Huh? So they remain the same, right? No. Oh. Eliminated at least. There are 4 finalists, I will tell. Vaibhav, 270. Falak, 220. Amit, 210. Shiveha, 180. So all of you, all these 4 qualified for finals.
Okay, ma'am.
Okay, next. Soumya, Lakshya, Ashmita and Shivam. Soumya, Lakshya, Ashmita and Shivam.
Yes, ma'am.
Thank you. Thank you for participating. You can
Thank you, ma'am.
join, you can see through the YouTube. Please be there, but let us have this interesting. Okay.
Okay, ma'am.
Thank you for participating, Lakshya, Ashmita, Shivam and Soumya.
Thank you, ma'am.
Good attempts by all of you. Yes. Yeah. So can we? Is everybody here from our quiz team?
Yes, ma'am.
Yes, I am assigning the number again. We are reshuffling. We are reshuffling you again. Okay. Please rename according to your numbers which we give. Because let it not be constant. That's why we are doing this reshuffling again and again. Yes. Did we get? Yes. Shiveha, you are participant 1 now.
Okay, ma'am.
Please rename as 1. Second, Amit, you are second now.
Okay, ma'am.
Vaibhav, you are third.
Okay, ma'am. Okay.
Falak, you are fourth.
Okay, ma'am. Okay, ma'am.
Falak, you are in the cab now.
Ma'am, I'm actually waiting for the cab outside the hotel, ma'am. Still, it is not.
Then how will you do the finals?
Ma'am, I'll try to like manage because what else can I do, ma'am?
What will you do to catch you are in the finals now?
Ma'am, my flight is at 4, so I'm just reaching there for like just for the sake of that I don't have to rush at the last moment, so that's why I try to like.
So what will you do? Your connection will be unstable, no? Huh?
Ma'am, how many rounds are there like in total final?
4.
Okay, ma'am. And how much time like can we expect that?
1 hour.
Okay, ma'am. So ma'am, I can manage for 1 hour, ma'am.
Okay, whatever it is, your internet connections I will not entertain because now I am
Okay,
not keeping. Now I am not keeping pounds.
Yes, ma'am. Yes, ma'am.
Okay. But
Okay,
it's only bounce in these rounds and see. Okay, shall we start with the final rounds? I will switch on the video. Okay. Who is the participant 1? Yes, I will tell you the rounds. I will tell you the rounds. What all rounds we have. Okay. We have clinical scenario. We have spot diagnosis. We have reverse diagnosis. And we have rapid fire.
Can I have the scores once, please? I missed that probably.
Why did you miss Vaibhav?
Sorry.
Vaibhav, you are at 270, Vaibhav. Okay.
Other teams, please.
Falak 220, Amit 210, Shiveha 180. Can I know from which colleges you are again? Vaibhav, you are from?
I'm RGKar Medical College, Kolkata.
Huh? Kolkata.
Yes,
which college?
RGKar, ma'am.
RGKar. Falak?
Ma'am, from All Indian Institute of Medical Sciences, Rishikesh, AIIMS Rishikesh.
AIIMS Rishikesh. Amit?
Jipmar, ma'am, Pondicherry.
Okay. Shiveha?
Ma'am, I'm from MAMC, Delhi.
Okay, all the best to you all 4. Enjoy the quiz. Okay?
Thank you.
Yes.
Ma'am, one doubt, ma'am.
Yes.
Ma'am, is there a negative for like a bounce question?
Bounce? No negatives for bounce.
Okay, ma'am.
Bounce is like just like pass. Okay.
Okay.
Okay. So can I start? Huh? I will tell you the rules and regulations. First round, we are going to this clinical case scenario, round 1. Then we will have the spot diagnosis, then we will have the reverse diagnosis, and then the rapid fire. So the rules for this, please, each participant will get one case-based scenario followed by a question pertaining to it. 60 seconds will be given to each participant to answer it. After I have read out the question, correct answers will be awarded 20 points. Bounce is applicable to this round. Okay, but next person who gets quiz masters will be there. Decision will be final and binding. Each participant will get one case-based scenario followed by a question pertaining to it. Okay, but there will be no negative marking for this. For the if you 9, I will take only one answer. Think and answer one, give one answer for this. Okay, no negative marking. If you should not keep on answering, because this is a past question. One answer within 60 seconds. If within 60 seconds you do not give one answer, then the question will pass to next if it is wrong. Okay. And I have given a hyperlink. You can choose which question you want to choose. Question 1, 2, 3, 4, you can choose. Okay. Can I have participant 1? Shiveha.
Yes, ma'am.
So no negative marking for the person who has bounced wrongly also. Okay. Even if negative mark, if Shiveha doesn't answer, it goes to next person Amit. He doesn't answer, then it goes to next person Vaibhav. But no negative markings for wrong answers. But there will be only one answer. So Shiveha, you have to tell me only one answer within 60 seconds.
Okay.
No, mine 30 seconds time. Bounce person get 30 seconds time. Within 30 seconds, you have to answer if the question has bounced to you. Okay, if it is a past question to you. And 10 points. Okay, rules are clear?
Yes, ma'am.
Yes. Shiveha, you can choose the questions. Which question do you want?
Ma'am, question 2.
Shall I click? Okay. Shiveha, clinical scenario for you. A 70-year-old female comes to the clinic with complaints of episodic pain on the left side of her face. She gives a history of sharp, severe shooting pain in the cheek and jaw since 5 years. She describes several things like chewing, touching her face, brushing her gums that triggered the pain. She had involuntary contractions of one side of the face, beginning with the involvement of orbicularis oculi, leading to brief, intermittent, painless, involuntary closure of ipsilateral eye. But over the years, it progressed to involve most of the muscles of the lower left side of her face. Okay. So initial management was with carbamazepine and regular botulinum neurotoxin injections. But however, symptoms of both conditions recurred. MRI of her brain showed the following findings, which I will display. What is your final diagnosis? You have to give me one answer. Think, okay, within 60 seconds you have time. If you want, you take time to go through the question. Chewing, touching her face, sharp shooting, severe pain, but along with there is involvement of orbicularis oculi. Okay. So this is the MRI finding. And your time starts now. Think and answer. .30 seconds remaining, Shiveha. You can attempt You can tell one answer. It is, if it is wrong, let it be.
Ma'am, ventral pontine syndrome.
Okay, it is wrong. Okay. Next person.
Paratrigeminal syndrome.
Next person.
Ma'am, my chance.
Ma'am, second one, no. Ma'am, I said paratrigeminal syndrome, ma'am. Is that wrong or right?
That's why I am asking next person.
Ma'am, trigeminal neuralgia.
Next person, Falak. You have 20 seconds remaining, 10 seconds, 15 seconds, 10 seconds. Time is up, Falak. So it has been bounced to all the persons.
Ma'am, actually,
time up.
Okay.
Time up. So it is only 30 seconds. If you tell me one answer, it is wrong, I will go to next person. So there has been no right answer for this. Right? Okay. So shall I tell the answer now? So it was a painful tick convulsive. MRI showed the left vertebral artery, which is dolichoactic tick. Okay. That indented and displaced both the facial and trigeminal nerves. Next person, Amit.
Yes, ma'am.
Amit, you can choose from 1, 3, 4.
Third one, ma'am.
Huh?
Third one.
Third one. Can you all please keep your videos on? Is it on?
It's on, ma'am.
Okay. Question number 3, Amit. So, an 8-year-old child presented to the pediatrics OPD with complaints of dystonia, initially starting in the feet with stiffness and feeling of tightness in the legs. Okay. Both progressing to upper limbs, difficulty in articulating speech, clumsiness while performing fine movements, difficulty in walking and maintaining balance and posture. Mother gives history of delayed achievement of gross and fine motor milestones. Okay. So, equinovarus deformity of both the feet were noted on head-to-toe examination. On ophthalmoscopy examination, fundus revealed the bone's pigmentation pattern. I will show you the MRI. T2-weighted MRI was done and showed the following condition. Okay. So, please go through the question. There was stiffness, tightness of legs and articulation abnormality and delayed achievement of gross and fine motor milestones. Okay. So, MRI was this. Time starts now.
Efson's disease, ma'am, with retinitis pigmentosa. Bardet-Biedl syndrome.
I had told only one answer, you had time. Right? So your answer is already given. So next it passed. It is passed to Vaibhav. 30 seconds times.
Usher syndrome.
Yes?
Usher syndrome.
No. Next person.
Falak, ma'am, yes. Ma'am, is it ma'am NERP, NARP syndrome, neuropathy, ataxia, retinitis pigmentosa, NERP syndrome?
No. Next, Shiveha.
Ma'am, I had also thought of NARP. I don't have another answer.
Okay. Okay. So nobody has answered it rightly. Okay. I will tell the answer. Okay. Hellervin-Spart syndrome it is. Okay. Pantothenate kinase associated neurodegeneration. It's an autosomal recessive disorder with iron deposition in globus pallidus and substantia nigra of the basal ganglia, and is associated. It is diagnosed by molecular genetic testing. Okay, so characteristic finding on T2-weighted MRI of basal ganglia called eye of tiger sign is detected. Okay, so can we ask the third person, Vaibhav? This is click.
Yes, ma'am. Am I audible?
Yes, you have only 2 questions to select. 1 and 4. Which you want?
4.
Okay. So this is your question, Vaibhav. A previously healthy 3-year-old Hispanic female presented with intermittent ataxia, behavioral changes since 3 days. Her past medical history was relevant for uneventful full-term gestation, chronically dilated pupils and large PDA. What is this? What happened? Just a minute. Sorry. Okay, sorry. They have not, she revealed it was on examination, there was chronically dilated pupils and large PDA requiring autoplasty at 5 months of age. And there were frequent pulmonary infections. Symptoms observed by caretakers included intermittent ataxia, decreased speech, fluctuating mental status, and activity level, with additional reports that she would cry intermittently without clear cause. She had prior normal development with no previous neurologic history, including no history of seizures, stroke, muscle weakness, or ataxia. Okay. So EEG showed predominantly right occipital slowing, but no electrographic correlation to suggest clinical behaviors which were secondary to seizure activity. All laboratory workup on the patient were negative, like infectious workup and complete blood count, erythrocyte sedimentation rate, C-reactive protein, and cerebrospinal profile. All was negative. Metabolic workup, toxicology, screen, thyroid panel, complete metabolic profile, muscle creatinine kinase, copper, folate, B12, and CSF lactate was all normal. Okay. So MRI of the brain showed a foreshortened corpus callosum with a radial paramedian pericallosal grail pattern. The basilar artery impression on the pons was slightly pronounced. Identify the diagnosis. So basically we want to take out all the negative things. Okay, infections are ruled out. You can see the metabolic profile was almost normal, and then image showed foreshortened corpus callosum with radial paramedian pericallosal gyral pattern. So this is the image, and your time starts now. You have 60 seconds. Take your time and answer. Everything has been described actually.
Corpus callosal agenesis.
No. Okay. Vaibhav, this is Vaibhav, right? I will pass it to Falak. Thirty seconds. Falak, 30 seconds.
No, ma'am. No.
Pass. Shiveha, you get the chance.
Is it Marcia Fava Bignami disease?
No. Next, Amit, you get the chance.
Ma'am, ACTA 2 leukovasculopathy, ma'am.
What?
ACTA 2 leukovasculopathy.
So there was no malpractice?
Yes. You can see, ma'am. I'll show you.
Huh?
The camera was off.
Camera was off for long.
Camera was off for a long time.
Last 2 rounds. Last 2 questions.
Ma'am, camera was on only throughout, ma'am.
Monitoring. Two of them are more watching.
It was on throughout, ma'am. Maybe some issue, but honestly speaking, ma'am, it was on throughout.
Let's give it.
Okay. Okay, 10 marks. Okay, that is true, right? Huh?
Next.
So next is only, no. Next. Okay, so what you answered is right. Huh? ACTA 2 leukovasculopathy. So next, last person. Palak, are you there?
Yes, ma'am.
Shall I tell you, ask the question?
Yes, ma'am.
Okay. So a 45-year-old man, non-smoker, was referred to a specialty clinic because a CT scan of his chest found pulmonary cysts bilaterally at the basis of his lungs. He gave a history of recurrent bilateral pneumothorax in his 20s, which required bilateral pleurectomies. Okay. His daughter and younger sister suffered spontaneous pneumothorax at ages of 13 and 35, respectively. So spirometry and the transfer factor of patients' lung for carbon monoxide were normal. Serum alpha-1 antitrypsin was normal. Okay, what is your diagnosis? The image is displayed here. Okay, your time starts now. If you want question, I will read.
Ma'am, can you show the question again once?
Yes, CT scan showing bilateral cyst, alpha-1 antitrypsin normal, daughter and younger sister suffered pneumothorax.
Ma'am, is it a case of ADPKD? No.
Your answer is that? 6 seconds.
ADPKD, ma'am.
Okay. Pass. Shiveha.
Ma'am, bird dog Hubei syndrome.
Okay. I will give marks. So I will give marks 10 to Shiveha. Okay.
Ma'am, is this round for plus 20 or plus 10? Acha, bounce.
Bounce. Pass. It is pass.
Okay. Okay.
All right. It's a Birt-Hogg-Duke syndrome, autosomal dominant condition by germline mutations. Okay, if they in the FLSEN gene, with skin fibrofolliculomas, multiple lung cysts, and spontaneous pneumothorax and renal cancer. Okay, so the first round is over. Second round, I will go to the second round. So shall we have the participant 1, 2, 3, 4? Okay. Next round is spot diagnosis, Shiveha.
Yes, ma'am.
Okay. So each participant will get a question having an investigatory finding. Just a image will be shown. You have to tell me the condition. Okay. Based on it, diagnosis has to be made. 60 seconds will be given to each participant to answer it after the question is displayed. Okay, but see, if you answer once, that is over. You think and answer because you are having 60 seconds. Okay, correct answers will be awarded 20 points. Bounce is applicable to this round as well. Okay, understood? Quiz master's decision will be final. So this first round. This is the first round. First image will be displayed. Take your time. If you don't answer, only one answer you give me. If you utter once, if it is negative, wrong, I will go to next person. So take time and answer. Condition.
Box-shaped heart in Epstein's anomaly.
Okay, correct. 20 points to her. Okay. So next person, Amit, are you there?
Yes, ma'am.
Amit.
I'm there, ma'am.
Okay. So I want you to, this is okay, what she told. Next question, I will be displaying an ECG. I want you to tell the name of that sign, okay? So this was an ECG trip of diabetic female presenting with chest pain, showing radiation to, having radiation to jaw and neck, shoulder and neck, okay? You have to tell me the sign in this ECG. Time has started. Think and answer. Last 20 seconds remaining. Shall I pass the question?
Thank you, back sign.
Pass. Next person, Vaibhav. Starts, time starts.
Ma'am, can I see the question once?
It is sign. Identify this sign. Over. On the ECG.
Ma'am, acute pericarditis, concave upward ST segment.
I am asking the sign. Next, Falak.
Hockey stick sign.
No. Next, Shiveha.
Square root sign.
No. Okay. So it is passed. Okay. Everybody has not answered correctly. It is Wellens sign. Okay. It is known as Wellens sign. Seen in left anterior descending coronary artery stenosis, critical stenosis. Okay. First it will be biphasic and it will become depression. T-wave depressions and V2, V3. Okay. Wellens sign. Fine. Next, Vaibhav, can I have you?
Yes, ma'am.
Okay. So next question. In the meantime, other participants, I want hands like this. Please monitor, whoever is monitoring, make sure everybody is keeping their hands like this. No image scanning, no image. Okay. Others. If somebody is there, even if it passes and they answer rightly, I'm not giving marks. Okay, next, Vaibhav, to you. You identify and tell me the condition. Condition. Time starts. You have time, think.
Paget's disease.
Okay, correct, Vaibhav. Plus 20 for Vaibhav. Okay. So next, Falak, can I have you?
Yes, ma'am.
Yes. So this is Paget's disease, candle flame sign or blade of grass side. Okay, Falak. Next, when I show you the image, you have to tell me the diagnosis and exact wordings. Okay. Understood?
Okay. Yes, ma'am.
Okay. So other participants, hand like this. Okay. No prompting. Falak. 80 years old male diabetic patient with dysphagia, regurgitation, retrosternal pain. Barium swallow radiography was done. Diagnosis. Think and answer. You have time. 60 seconds. Give me one correct answer. We are not hearing you, Falak. Are you
Ma'am,
speaking something?
Ma'am, actually, just thinking.
Okay.
Ma'am, how much time is left?
20 seconds.
Is it paraesophageal hernia?
Yes. Okay. 20 marks. Okay. Next round we will go. Next is reverse diagnosis round. It is a little different round. I will tell you the rules and regulations. I will give you the option to choose the question number which you want to choose. Okay. I will tell you the rules and regulations of this reverse diagnosis, which is a clue-based round. Okay. You will have different clues. A direct question will be asked to each participant. A master clue will be given. Okay, one master clue will be given. 4 clues will be made available after the master clue, from which the participant can choose any clue and in any order. Okay. Participants cannot answer only with the master clue and will have to choose a minimum of 1 clue. So we will give you 1 master clue image and along with that 1 clue. If you answer with that much, okay, your marks is 40 and only 1 attempt is allowed. Okay, which clue you want to select one after the other? You cannot shuffle. You tell me one and final. A wrong answer will get negative marking because we are giving you all the options to choose all the clues and all the investigations along with all the question choosing option. Okay, pounds and bounds are not there for this round. So no bounds, no pounds. Over. Chance is over for all the extra scoring. Quiz master will rule if the answer is correct or incorrect. No time limit for this round because I am going to ask you questions. Okay, reasonable amount of time will be given because you have to select clues. But come to one particular diagnosis. If you don't keep on uttering one after the other, this ma'am, that ma'am, don't ask. Okay, if you don't understand and don't get the answer, go to the next clue. You have 4 clues, but the points will be decreased. So 1 clue with the master clue, 40 points. Correct answer if you give with the master clue, it is 40 points. If you utter wrongly, wrong answer, minus 30 points. So be very careful. You have other clues to be taken. If 2 clues you use, you will get 30 points. But if you again answer wrongly, minus 20 points. 3 clues, number of clues taken, 3. Then if you answer correctly, 20 points. Minus 10 points if you answer negatively. If you take all the 4 clues and answer, you will still get 10 points. So utilize all the clues if you do not know the answer and don't utter the wrong answer. Okay, because I am keeping the negative marks for this. So,
excuse me.
Yes.
If after utilizing all the clues, we are still not able to come to a final answer. I mean, in a case we are passing the question, choosing to not attempt, will that lead to negative result?
No pass. If you are not attempting the question, no marks. I am not giving negative marks. If you answer wrongly, it is negative marks.
Ma'am, one question, like if we don't attempt even after 4 clues, like we can be awarded 0 but no negatives, right?
Yes, sir.
If we don't answer even after 4 clues, then we will.
And that's what he was asking. That is what he was asking. Even after 4 clues, if you don't answer, no issues. Okay. But after the 4th clue, I will keep a timer of 30 seconds. Okay, of 30 seconds, I will keep a timer. You cannot keep on taking the whole time which you want. Okay, show me 1 clue, show me next clue, show me 3rd clue, show me 4th clue. No, 1 clue I will display only once. Okay, so you have to remember what clues we have given. Because we are giving you all the options to choose which questions. Okay, fine. Is it clear for marks allotting persons? Yes. If they don't answer after 4 clues, no negative marking. If they answer it wrongly, -5 points. If they answer it correctly, 10 points. Okay. Shall I go ahead with the first person?
Yes,
Shiveha?
ma'am. Yes, ma'am.
Since we couldn't take out sheets, we have given you the options of selecting the question. Okay. In an online round. So you can choose the question which you want, Shiveha.
Question 3.
You have the rounds rules clear, right, Shiveha?
Yes, ma'am.
Okay. Question 3, one image will be displayed and you will take one clue. Okay. Question 3. So this is your image. You can just go through the image for 5 to 10 seconds. You go through the image. Which clue you want, Shiveha?
Ma'am, the etiology.
Etiology clue? Okay, I will show you the clue. I am not coming back to the master clue.
Okay, ma'am.
Clue 2. Etiology is a rare autosomal dominant cause of secondary hypertension. Okay. So gain in function mutations of ENaC mutation subunits, okay, which increase its activity and cause sodium retention.
Ma'am, Liddle syndrome.
Okay, very good, Shiveha. You have taken one clue and answered it correctly with the master clue, plus 40 for you. Okay, shall I go to the next question? Second person, master clue. Okay, very good, Shiveha. Next. Question number, participant number 2, Amit. So choose wisely which you want. Participant 2, Amit, are you there?
Yes, ma'am. I'll go with question number.
Hands. Because I don't know, you have been in scrutiny. Okay. So question number 2, which number?
2, ma'am. Question number 2.
2? Yes. Yes, Amit. Okay. So I will give you the clue. This is a master clue. This is ventriculography in right anterior oblique view. Okay. And end diastole. Okay, this is in end diastole. This is end systole. Same image is seen in A, but with enhanced endocardial borders, and B with same endocardial borders are enhanced for you. So which you go through the image for 10 seconds and tell me which clue you want to take. Which clue you want to take, Amit?
Can I have 10 more seconds?
Yes, you can have.
ETO only, ma'am, etiology.
2, 3 etiology you want? Okay, I will show you the clue 3. Okay, so the most plausible cause responsible for this condition is sudden release of stress hormones such as norepinephrine, epinephrine, and dopamine, causing cardiac stunning. Stunning the heart triggers changes in the cardiac myocytes and coronary perfusion. It is typically triggered by an unexpected emotional or physical stressful event. You have to tell me correct answer with the name. Okay, please take your time and answer. You tell me the name. Okay, take your time and answer. If you want next clue, I will give. Okay, very good. Fine. That is fine. Plus 40 for him? Yes. Okay. Next, Vaibhav. Vaibhav, are you there?
Yes, ma'am. Ma'am, I'll go with 4.
4. Okay. So you have this image. Okay. Please go through the image for 10 seconds and ask me one clue. Which clue do you want, Vaibhav?
Ma'am, please give me 10 seconds more. Ma'am, I'll go with etiology.
Everybody wants an etiology. Okay, Shiviha give the read. Okay, so I will tell you the etiology. Combination of alcohol-induced neurotoxicity and deficiency of the B complex vitamins. Sudden fluctuation in serum osmolality known as callosal malinolysis as a complication of ketoacidosis caused by diabetes or alcoholism. Take your time and give me one answer if you know, or choose other clues. Do you want any other clue, Vaibhav?
Yes, ma'am. Please, 10 seconds more. Ma'am, can I go with investigation?
Investigation clue?
Sorry, ma'am. Pardon. History, sorry. History, I meant, sorry.
What happened?
Sorry, ma'am. I'll go with history.
History, okay.
Yeah.
Okay. Okay. History is 57-year-old man presented to neurology OPD with impairment of recent memory, confusion, seizure, dysarthria, limb hypertonia, delirium, personality changes, and gait apraxia for 1 month. Patient gives history of moderate alcoholism ending 10 years before. Think and answer. Do you want another clue, Vaibhav? You can utilize all the clues. No issues.
Confused between 2 options.
No, you have to tell me one answer.
Yes.
Investigation and management.
Ma'am, I'll go with management.
Okay, no issues. So you have had 2 clues. This is your third clue. No specific treatment is proven. Parenteral thiamine is usually administered.
Ma'am, Marchia-Fava-Bignami syndrome.
Okay, I will give you marks. Okay. So it is 20 marks for him. Correct, Vaibhav? Okay. This is next one. Correct, Vaibhav. Okay. Shall we have fun?
Yes, ma'am.
Okay. Next question, Upma. So question 1 is remaining for us. It is for you. Shall I go start, Phala?
Yes, ma'am. Yes, ma'am.
Yes. So this is the X-ray finding of leg. Okay. AP and lateral views. Okay, just go through the image. Okay, and there is one more image or along with this. You go through this image. I will go to the next slide. Shall I change the slide?
Ma'am, yes, you may.
Yeah, there is one more image. So I want to, you can flip the images again. This is also the image along with that. Okay, you can go through the images and ask me one clue.
Okay, ma'am. Ma'am, can you show the previous image again?
Yes.
Ma'am, the previous X-ray.
Previous X-ray?
Yes.
Yes. Okay, shall I, can you opt a clue for
Okay,
now?
yes. Yes, ma'am.
Yes. Okay, you tell me which clue you want.
Ma'am, genetics, ma'am.
Okay. So this is the mutations in IDH1, 2 and PTHR1 genes, which have been linked to this condition. These mutations are due to somatic mosaicism. So far, all the cases of disease have been sporadic in their families and not inherited. But in theory, the condition could also be inherited and has an autosomal dominant pattern. Okay, take your time. You have to tell me the correct disease, what it is. Okay. You can take your time to think.
Ma'am, the histopathology.
Okay. Histopathology shows macroscopic examination usually shows multiple oval or round cartilaginous nodules in osseous portions of bone. Okay. Individual nodules are limited at their periphery by oven or lamellar bone and are separated from each other by intertrabecular marrow spaces. Tumor matrix is usually solid with myxoid changes, which manifest as frayings of the matrix. They are characterized by the presence of a striking heterogeneity and diversity in the degree of cellularity and chondrocyte phenotype. You can take time, think. Do you want a next clue?
Yes, ma'am, definitely, ma'am. Clinical presentation.
Clinical presentation? Okay. So, a 13-year-old female patient came to the physician with complaints of difficulty in walking, leg pain, and multiple swelling in the hands and legs for 3 years. There was also shortening of the right leg, which was noticed by her parents since she was 4 years of age. Okay. There was no significant family history. On examination, multiple discrete hard swellings were palpable in both legs and hands. There are multiple discrete hard swellings in the legs and hands.
Ma'am, I have
Don't answer if you do not know. You
yes, ma'am. Yes, exactly. Yes. Yes, ma'am. That's why I'm actually not uttering the answer because I'm actually confused.
Tell me if you want next clue.
Ma'am, management portion.
Okay, no issues. You take all the options, but answer correctly if you want to answer. Surgical correction of deformities of the affected limb has been helpful. In severe cases, artificial joint replacement may become necessary. Fractures routinely heal without complications. Other treatments are just symptomatic and supportive. Now you have taken all the clues. Now I will start the time. Okay. Time has started.
Ma'am, if I answer incorrect, then I'll be having -5.
Yes.
Okay.
Last 10 seconds.
Ma'am, diaphragm.
Okay, your time is up. Falak,
Yes,
right?
ma'am. Ma'am, now can I attempt the just for the sake of
Yes, just say for the sake you attempt.
diaphyseal achalasia like this?
What?
Diaphyseal achalasia.
No. It was Olliar's disease. Okay.
Okay.
Okay. No issues. Fine. We come to the end of all the rounds, but only one round is remaining. This is rapid fire now. So I want to, before I start the rapid fire, I want to tell the marks of this round. This round. Only reverse diagnosis. Okay. So participant 1 is 40. Participant 2 is 40. Participant 3 is 20. No marks for participant 4. I will not be announcing the total marks or winners in this. It is being announced in the valedictory ceremony. So all of you be present, all the finalists. Okay. And you will be getting the prize there. Fine. Shall we go to the rapid fire? All of you are ready? Should we finish Falak first if he is busy? Yes, you want?
Ma'am, we can follow the order also. I'm sure. And we can follow the order 1, 2, 3, 4.
So is okay?
Yes, ma'am, it's okay.
Okay. So next. Shall I go ahead? So I'm not going to the to all this. 4. So did you enjoy the quiz?
Yes, ma'am.
Yes, ma'am, definitely.
Definitely. Okay. So we are coming for the rapid fire round. Okay. So here in rapid fire, there is no negative marking. I will tell you the rules. Okay. Are they going to get the option to choose the sets? No, right? No. Okay. So we have given you options in all these 3 with bounce, pass, with to choose, since there was no chance to take out the chits. Okay. So rapid fire. I'll be asking 10 questions to each participant. Time allotted is 90 seconds. Okay. If a participant does not know the answer, please say skip, pass, next at least. Okay. Till you say that I'm not going to the next question. And I will say whether the answer is correct or wrong. For every correct answer, you will receive 5 points. How many points? 5 points. But there will be no negative marking. And there is no bounce in this round. Okay, it is rapid fire, 90 seconds. Other participants should remain quiet and should not prompt the answer. Please mute. Failure to do so will account to malpractice and points will be deducted from that participant. For every prompt, I will take out minus 10. Okay, so a buzzer will be buzzed when around 30 seconds are remaining, not 10 seconds. 30 seconds are remaining. Okay, you can say pass, pass, pass. And if you have extra time left after completing all the questions, you can go back to the past questions. Understood? Okay, am I clear?
Yes, ma'am.
Excuse me, ma'am.
Yes, ma'am.
Ma'am, 2 cases. One in which we pass the question and in another one in which we attempt it wrong. Can we?
I will be telling right, wrong. Right. If you attempt over.
When it's attempted, it's done, right?
Done.
Okay, ma'am.
But I won't.
Now we can come back to the question. Now one
Yes,
question.
you can come back to the question.
Okay, ma'am.
So can I have Shiveha?
Yes, ma'am.
Okay. So Shiveha, see, I will be asking and I will be, please concentrate on what I am asking. Okay. Don't, if you do not know, please tell pass, pass, pass. No,
Okay, ma'am.
The questions will be displayed there only, and you can go back to go back and answer if the time is left.
Ma'am, after I have finished all my questions, or if I remember in between, I can answer. ऐसे कि इसका 2 का ये था time.
You can answer. You can answer.
Okay, ma'am.
It's your
Okay.
time. It's your time. 90 seconds is your time.
Okay, ma'am. Yes, ma'am.
Okay. So shall I start? All others are mute. Others are mute, right? Are you checking?
Ahmed Singh is not. Yeah, now he is.
Now yes. Okay. Okay. 1. Shiveha. This is every time I have to press next. Okay. You. Okay. Misty mesentery in CT scan indicates.
Pass.
Samter's triad is characterized by.
Ma'am, asthma, nasal polyps, and aspirin sensitivity.
Right. Next gene mutation in CHARGE syndrome is.
Ma'am, pass.
Fear of sinning or imaginary crimes is known as.
Pass.
Miller-Kurzweil test is used for.
Ma'am, pass.
The most common cardiovascular manifestation of Graves' disease is.
Pass.
Percentage of malignant transformation of fibroid is.
Ma'am, 0.2 to 0.3%.
Wrong. COVID-19 exacerbation is prevented by vitamin
C.
Wrong. Rickler's sign on chest X-ray is seen in.
Ma'am, pass.
Carl Eisner bodies are formed by.
Ma'am, granulosa cells.
30 seconds are remaining.
Granulosa cells.
Okay, 30 seconds are remaining. You want to attempt anything?
Ma'am, gene mutation in CHARGE syndrome is CDH.
Which one?
Ma'am, CHARGE syndrome gene mutation is CDH1.
Which chromosome? Which correct?
Ma'am, chromosome 22.
CHD?
CHD1, 2. CHD1.
No,
CHD7. Ma'am, CHD7.
Time over, Shiveha.
Ma'am,
Okay.
CHD7, CHD.
But no, it was not in the right time.
Okay.
Timing is very important in rapid fire. Okay. So you have attempted how many right? 2 right. Okay. 2 right. Okay. The answers were, it indicates mesenteric fat attenuation. Samter's triad you got right. It is CHD7. Fear of sinning or imaginary crimes is pekatophobia. Miller-Kurzweil test is used for infertility. Okay, most common cardiac manifestation is sinus tachycardia. Okay, percentage of malignant transformation is 0.1. Your exacerbation is prevented by vitamin D, and Rickler's sign is pneumoperitoneum. And you answered this granulosa cells of ovary is correct. Okay, shall we have next person? Amit? Amit?
Yes, ma'am. Yes, ma'am.
Okay, are you ready?
5 seconds, ma'am. Yes.
Okay. Okay. Okay, rapid fire is intense. Okay.
Yes, ma'am. Let's do this.
Yes, let's do this. Okay, man. Okay, Amit. So if you do not know, please tell pass. If you know, answer correctly. If you answer once wrongly, I'm going to tell me next question. Wrong, and I'll go to next question. Okay. Okay. So the major cell entry receptors of SARS-CoV-2 is?
ACE1.
Okay. The gold standard for diagnosis of obstructive sleep
Pass.
apnea is? Causative agent for granuloma inguinal is?
Pass.
Margetuximab is approved for?
Pass.
Garden spade deformity is seen in
Garden spade. Pass, ma'am.
red degeneration of fibroid is most common in dash trimester of pregnancy. Hereford syndrome comprises of
Pass, ma'am.
Shallicosis is due to inhalation of
Pass.
normal aqueous production rate is
2 to 4 microliter.
Okay, right. Next, pregnant women with sickle cell trait are at higher risk of developing
Acute chest syndrome.
which infection?
Salmonella. Ma'am, third one is Klebsiella granulomatosis, ma'am. Fifth one is Smith fracture, ma'am. Margetuximab, ma'am, breast cancer, sleep apnea, polysomnography, ma'am, not sure, polysomnography.
Okay, next. Anything?
Rest, not sure, ma'am. Charlicosis, Hereford syndrome.
Over. Time over. Okay, you have got some answers correct. Okay, major entry. Okay, that is correct. So next, you have got this first right. Okay, ACE2 it is. I'm giving. So polysomnography is right. He got it right. Positive agent Klebsiella right. Margetuximab breast cancer right. Okay. So Smith's fracture he told fifth one right. Okay. Smith's fracture he told. Yes. Yes, he told no. Smith's fracture.
Yes.
Huh?
I told Smith fracture.
He told breast cancer. Next, Hereford's he did not attempt. Okay, this second trimester, it is second trimester of pregnancy, it is. Okay, Hereford's is parotid enlargement, anterior uveitis, fever and facial palsy. Okay, Shallicosis is due to stone dust inhalation, Amit. Normal aqueous production rate, you got it right, 2. 10th one, you did not get it right, Amit. Okay. Okay, pregnant women with UTI. Okay, so how many did you get right? 6. Okay. Shall we go ahead? Yes, who is speaking?
How many did I get right, ma'am? Can you just tell me?
6. Okay, shall we go to the next participant? Vaibhav, are you ready?
Yes, ma'am.
Can I begin, Vaibhav?
Yes, ma'am.
Just a minute, Vaibhav. Shall I begin? Okay, any confusion?
Amit is not on.
Amit, mute, please. Why is it echoing?
Sorry, ma'am.
Please mute. Everybody else, please mute. Shall I enter now? Set 3. Vaibhav, ready? Okay.
Yes, ma'am.
Maximum stump size to prevent stump appendicitis is?
5.
Okay. Mechanism of action of remdesivir is in treatment of COVID-19.
RNA polymerase inhibitor.
Okay. Triad of Cauda-Equina syndrome.
Cauda-Equina is bilateral pain, jerk absence. Pass. Next.
SARS-CoV-2 is cultured in biosafety level
3.
Trapdoor sign is seen in?
Pass.
According to Rome 4 criteria, prerequisite clinical feature for diagnosis of IBS is?
Not related to stool, not related, it should be related to stool frequency, abdominal pain, anxiety.
MEN1 syndrome is also known as?
Werner syndrome.
Specific antibody marker for diffuse systemic sclerosis is?
Topoisomerase, anti-topoisomerase. SCL70, anti-SCL70.
Cobb's rods are seen in?
Psoriasis.
Doubt's operation is done for? Operation is done for?
Cobb's rod is seen in diarrhea disease.
Doubt's operation is done for?
Pass. Diffuse systemic sclerosis is anti-SCL70 or topoisomerase.
Okay, next, anything?
And
IBS?
trapdoor sign is not sure. Diagnosis is which questions are left?
6th, 5th.
Ma'am, Cauda equina is
Over. Time over, Vaibhav. Okay. So I will tell you which you got correct. Okay. You got 5 mm right. This RNA dependent RNA polymerase, he got it right.
ma'am, appendicitis also is told 5.
Second one, no, you got it correct. Right. Hello, are you able to hear me, Vaibhav?
Yes, ma'am. Yes, ma'am.
Third one, you didn't answer correctly. Fourth, you said right. Okay. Trapdoor sign, you didn't answer. Okay. Sixth, you didn't answer correctly. Okay. Seventh, you answered rightly. Specific antibody marker, you answered it rightly. Okay. Cost rounds, you answered rightly. Doubts, operation, you didn't answer. It's for lumbar hernia. So can we know how many you answered correctly? 6. 6 you have answered correctly, Vaibhav. Am I clear?
Yes, ma'am. Yes.
Okay. Can we have Falak? Falak, your internet
Yes, ma'am.
connection is good?
Ma'am, hopefully. Am I audible right now?
Yes, you are audible right now because this is going to be time bound, Falak.
Yes, ma'am.
Huh?
Ma'am,
You
just
can
give me,
stop.
just give me like
Okay.
1 minute.
Okay. You take your time, you stop your cab if you're in cab. Because I'm not going to entertain the time if there are internet issues. Okay?
Excuse me, ma'am.
Yes.
In the meantime, can I join using my iPad? My phone is on 1%.
Huh? You can, he can. He can. This is the last round anyways. I'm not announcing the marks also. Like final marks, I'm not announcing.
Hello.
Yes, Falak, can I?
Yes, ma'am. Yes, ma'am.
Shall we?
Yes, ma'am.
Okay. Okay. Falak? Sorry, there is some disturbance from your side.
Ma'am, no. Hello. Am I not?
Yeah, okay.
Hello.
Okay.
Am I not audible, ma'am? Okay.
Yes, okay, you are audible and your time starts now. Okay, I will start the question, then your time starts. Sputnik V vaccine for SARS-CoV-2 contains dash serotypes.
Pass, ma'am. Pass, ma'am.
Most common location of accessory pathway in WPW syndrome is
The Kent pathway. The
gene on chromosome dash chromosome determines A and B blood groups.
chromosome number 9.
Most common extracutaneous complication of systemic sclerosis is
Ma'am, pass, ma'am.
target receptor for tocilizumab is
Interleukin 6.
okay. Site of lesion in Wernicke's hemianopic pupil is
The optic tract.
karyotype in Sware syndrome is
Ma'am, XY 46 XY.
Folfox regimen is used for dash carcinoma.
Colorectal carcinoma.
That's correct. Turnbuckle cast is used for
Turnbuckle cast. Ma'am, next question, please.
features of Charcot's neurologic triad.
Okay, ma'am. I'll pass. I'll reattempt.
Go back.
Ma'am, fourth Raynaud phenomena, and one contains serotype 1 and 3, and Turnbuckle cast is for humerus fracture for the, and 10th one is painful. Okay, painful neuropathy, sensation loss, and motor neuropathy. I'm not sure.
Karyotype in Sware syndrome.
Bye, ma'am.
Time over.
Okay, ma'am.
Okay. Okay. This one, second one is answered. I had asked. No. So this vaccine contains 5 and 26 adenovirus serotypes. The location was left free wall. Gene 9 chromosome, you answered correctly. Raynaud's phenomenon, he answered correctly. Okay. Tocilizumab, he answered interleukin 6 correctly. Optic tract, he answered correctly. For 7th, he didn't answer. XY.
Ma'am, actually I answered 7. Ma'am, I
Sorry.
answered 7.
Correctly. Sorry. Fox also he answered correctly. Okay. Turn buckle cast you didn't answer correctly. Correctly, Falak. And Charcot's neurologic triad
Yes,
also you didn't answer correctly. Scanning speech, intentional tremor, and nystagmus. Okay. So you also got 6 correct. Falak. Okay.
Okay, ma'am. Okay, ma'am.
So all the participants, thanks for participating. We are done with the rounds, but do we have a tiebreaker? We have to see. Just a minute. We don't have a tiebreaker. So we do not have any tiebreakers. Okay, or else we had prepared tiebreaker questions for you people. So did you enjoy?
Yes, ma'am. It
Yes,
was,
ma'am. Definitely.
Yes. Ma'am, a lot of brainstorming.
Ma'am,
a lot of brainstorming was there.
Brainstorming, okay. Which round did you enjoy the most?
Ma'am, I personally love that image, that connecting all the images one.
Connect the images? Okay.
Yes,
Shiveha, which round did you enjoy?
Yes, ma'am, I enjoyed the connect round, same as Falak, and I also enjoyed pretty much all the rounds in the finale. They were very nicely made, and I think the quiz overall had all types of questions and all types of aptitudes that were tested, like reflexes were tested, knowledge was tested, and strategy was tested. So it was a very, very well made quiz according to me.
Thank you from all the organizers also. Okay, they have put a lot of effort to prepare. Amit, which round did you enjoy? Because we are taking your feedback here only because we don't have feedback right in the form. Is that they will send you, it seems.
I think reverse diagnosis personally, because the master clue, in my opinion, for all questions was like really difficult. But then after taking the etiology or whatever, the first clue, like boom, it was a shocking change of events.
Okay, this was conceptualized by our organizers in the final year batches. It was a new type of round. Okay, so Vaibhav, which round did you enjoy?
Mostly the reverse diagnosis and the image-based connect were very good. Apart from that, all like it was very good that rarely we get to see in the quizzes that a certain reasoning and explanation sort of questions. Those were also and also like it was a very comprehensive quiz. Like everybody got an equal chance. So 8 to 9 rounds I hardly seen any quiz. So that was a very good thing.
Okay, we put
really
a lot of effort, and you put a lot of effort from that time. You are sitting and constantly answering, nicely answering. We enjoyed being in quiz with you, really. You did a very good job.
This was like literally the only quiz I have.
Yes? What happened to his internet?
The around for that recent advancement, most of us were in a fix, we hadn't heard the drug's name at first, so it was kind of key. All those concepts got brushed up. So thank you.
It's all the best for all the best in future.
That will give us extra.
Yes, very. Thank you for participating. We really enjoyed doing the quiz with you. Amit, you were saying something. Your internet connection got unstable. We didn't hear you.
I mean, this is the only quiz I've come across, ma'am, till date, in which so much scrutiny was done to make sure not a lot of cheating happens. So that was one plus point about this quiz.
Yes, because we were trying to give equal chances to everybody, so we were shuffling and we are giving the hyperlinks to choose which questions because that cheat system were not there, no. It would have been good if there was no COVID. We would have enjoyed doing it in offline, I think. We could have met more people and had more interaction with everybody. But I would like to still know the colleges, because it was a brainstorming session for me also. I would like to know your colleges once again, if you can. Shiveha, you are from AMC, you told, Delhi.
Yes, ma'am. Yes, ma'am.
Vaibhav?
Ma'am, I am from Arjikar Medical College and Hospital, Kolkata.
Kolkata. I have not heard it very often because it's a far place. Yes, Falak, you are from AIIMS, right?
Yes, ma'am. Rishikesh.
AIIMS Rishikesh. Very nice. Amit?
Jipmer Pondicherry, ma'am.
Jipman, very good. All of you have done very well. Thank you. So shall we shall end this meeting.
Okay, ma'am.
Okay, before, and there will be a vote of thanks by our organizer. This is Aishwarya. Okay, so please show the curators also. They have done they were awake all the night to frame your questions and help me with. Okay, this is Gayatri. This is Aman. Shubhradeep. Yes. At least let's have an interaction because it is online. Yes. Okay. So these are the people who are monitoring you, Amit. Okay. These are the monitoring persons who were monitoring you. Okay. Aishwarya and Kshitish are the organizers, main organizers who made all the PPTs and hyperlink. Okay. So we had buzzers also who were not allowing you to go beyond time. Okay. So, and there was, what's your name? Karishma and all helping from other different phases of the MBBS. Okay. For scoring sessions. You can do the vote of thanks.
Good afternoon to one and all. It is an honor to deliver the vote of thanks at the Occam's Razor Clinical Quiz for our annual conference Asclepius 2021, actualized by JSS Medical College and JSS Academy of Higher Education and Research. I'd like to begin by extending my humble pranams to His Holiness Jagadguru Dr. Shri Shivratri Rajendra Mahaswamiji and seeking the blessings from His Holiness Jagadguru Shri Shivratri Deshikendra Mahaswamiji. I would like to express my gratitude to our mother organization, JSS Academy of Higher Education and Research, and our Honorable Principal, Dr. H. Basavanagodappa sir, for providing us with unconditional support in bringing this quiz to reality. We are grateful to Dr. G.V. Manjunatha, Vice Principal Clinicals, and Dr. M.N. Suma, Vice Principal of Pre and Para Clinicals. Just like Rome wasn't built in a day, conducting a national level quiz could not happen overnight. It requires planning, dedication, and hard work. And we have been fortunate to be backed by the official members of the Medical Education Unit, Student Research Council, Literary Committee, and many other devoted organizers in the course of this conference, who spare no efforts in making the event a success and work day in and day out sincerely. We are grateful and immensely indebted to Dr. Praveen Kulkarni sir and Dr. Varsha ma'am, who have been with us in every step. And Praveen sir has been our guiding force throughout the years for Asclepius. Thank you, sir. We would like to thank Dr. Varsha ma'am, our quizmaster, who has worked again day in and day night to help us form the questions, who helped us arrange the slides and told us how to make it presentable. Thank you, ma'am. We sincerely thank all the faculty from JSS Medical College for providing us with a helping hand. I would like to thank all the delegates for being a part of this conference. Thank you for bringing great spirit to this conference. I hope that you can take back immense knowledge from this event. I thank our sponsors, Maro, Lecturio, Simsa, and Picmonic for the smooth conduction and supporting us throughout this quiz. Last but not the least, I thank all organizers and the organizers of Asclepius and the volunteers for their cooperation, patience, and meticulous precision in organizing this event. A special thanks to the audience who've joined us today as well on YouTube and as attendees on the Zoom call. Thank you, everyone. We hope you had a wonderful learning experience. Thank you.
Thank you. Okay.
Thank you, ma'am. Thank you, Aishwarya.
Okay. Thanks all and all. So I will be ending the meeting. Okay. So please join the valedictory ceremony. Right. So where the quiz two winners will be announced. Okay. 2 winners. Okay. Please join the closing ceremony. All the best. If Falak, what about Falak? He will be in flight. Okay. So all the best. Enjoy.
Thank you. Thank you.
Good
Thank
luck
you so much, ma'am.
Okay.
Thank you so much, ma'am. Thank you.
Bye. We'll end. I want to